in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight,
This lad's just ran out across the road.
a boy is run over on his way to school.
Can you move your right arm?
A woman suffers a horrific open ankle fracture.
Nice deep breath,
Well done.
Sandra. That's it, well done. Nice deep breath.
A horse riding disaster,
On the left, on the left part of my neck.
Yeah.
and a man has a cardiac arrest in front of his daughter.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing. Hello, are you all right? How you doing?
Critical care paramedic Pete Edwards joined the ambulance service 15 years ago.
Just thought I'd give the car a bit of a clean. Looks nice when it's clean, so...
5 years ago, he underwent specialised training and is now a member of the critical care team.
Nearly done, sorry.
The critical care team rely on their fleet of high-performance vehicles to get them and their specialised equipment to an emergency in the quickest time possible to provide vital life-saving backup to the ambulance service.
This bag, the red bag, or bag 1 as we sometimes call it, is our enhanced care bag. So it's got some equipment in here that they don't carry on the ambulances, and that includes sort of surgical equipment. We've got some advanced airway equipment, extra little bits that the ambulance crews don't tend to have.
Ambulance services, the patient breathing.
This lad's just ran out across the road and I've hit him with the car.
Okay. Where's the pain that he's feeling?
Where's the pain? In his leg.
Is he in the road still?
Yeah, we're in the road.
You're okay, left. 13-year-old Patrick, hit by a car, patient is still in the road. So, yeah, we haven't got a huge amount, we've got an age. The rest we'll have to figure out once we get to scene.
An ambulance has been dispatched, but with the child's life in danger, Pete and fellow critical care paramedic Mike Andrews are also urgently needed.
We'll be there first, won't we, brother?
Yeah, we're going to be the first resource on scene, which is a bit unknown at the minute.
In a 12-hour shift, Pete and Mike will attend up to 8 emergencies. Their skills and training can make the difference to someone surviving or not, but only if they get to them in time.
That's completely blocked that way, Mike, by the looks of it. Some of this might just be general traffic, I don't know, or it could be because of what's happened.
In these freezing conditions, Pete and Mike will need to act fast to stop the child's injuries becoming critical.
Can't go the wrong way around in the dirt as much as I want to. I'm going to park us just in front, okay?
I'll press us in attendance. Mike, shall I get out and jump and have a quick look?
8 minutes after receiving the call, Pete and Mike are on scene.
Morning, how you doing? All right? Hello, Patrick. Hiya, mate. I'm Peter. I'm one of the paramedics with Westminster. Are you Mum?
Yes.
Hello, Mum.
Listen.
13-year-old Patrick was walking to school when he stepped off the pavement into the path of an oncoming car.
We're going to have a look at him. We're going to look after him for you, all right? We've just got here ourselves. He's talking to us. That's a good stop. Are you hurt?
Just not here.
Just your ear? OK, let's just have a quick look.
It's common in car versus pedestrian road traffic collisions for the pedestrian to have sustained multiple injuries. Using their enhanced trauma training, Pete will need to assess him quickly to prioritise treatment.
Can you move this arm just gently? Yeah, you can move it. Can you move your right arm?
Shoulder.
Your shoulder hurts. And what about your legs? Can you move it a little bit? Don't move it too much, as long as you can move. OK, all right.
Patrick is able to move his arms and legs so Pete can rule out a serious spinal injury.
OK, all right.
But the blood coming out of his right ear is a major concern.
It's a hemorrhage just out of his ear. I'll give him an update, mate.
All right. So potential for a base gun until we investigate it further.
Pete and Mike suspect Patrick may have fractured his skull, resulting in a build-up of blood in the brain. If so, he's at grave risk of a stroke or potentially fatal hemorrhage.
Happy to pass an ethane.
Yeah, mate.
Crew on red backup, just to see we'll get him out the cold, all right?
The Midlands Air Ambulance Service covers a region of 6 counties and 6,000 square miles, the largest operating area in the whole of the UK. Each helicopter is crewed by a pilot, an emergency doctor and a critical care paramedic.
Ambulance service, is the patient breathing?
Yeah, but she's struggling to breathe. She can't breathe in. She had a fall from a horse.
Okay, she's conscious though.
Yeah, well, we don't know if she was conscious when she fell. She was in shock. She walked round, sat down, she can't move.
Is she bleeding at all?
Not that we can see.
03 lifted with an ETA of 4 minutes.
A local ambulance crew, who are already on scene, have called for backup.
This is a female who is riding a horse at a trot. She's been thrown from the horse and impacted into a concrete step. She presents with quite significant pain. She's slightly hypotensive with a very weak radial pulse, looks very pale. Crew is struggling to get a handle on any sort of analgesia, I think due to her query, slight compromise on her pulse, etc. And have requested some support.
The rider's condition is deteriorating, so the air ambulance has been scrambled, with emergency doctor Matt Rowley and critical care paramedic Karen Baker on board.
It does make you concerned when you hear that someone's blood pressure is low, that they've got a very weak pulse, that they're very pale. It does make you concerned that she's potentially bleeding somewhere. So hopefully we'll get a better handle on that when we get on scene and get to have a look at her.
They need to find somewhere to land quickly.
Just coming into the overhead now.
A fall from a horse, even at low speed, can cause catastrophic injuries.
There are horses absolutely everywhere, but there's a field this side. Just giving it a wide berth because our dog walkers making their way across the field, so hopefully they'll be the other side of the field by the time we make the approach.
The rider could have broken her back or be suffering from a potentially fatal internal bleed.
2-3 on the ground.
Finally on the ground, Matt and Karen arrive on scene.
Rachel. Hello, I'm Matt, this is Karen. Where's the worst of your pain at the moment? Inside your chest. Okay.
49-year-old Rachel, an experienced rider, was turning off the road into a field when a sudden hailstorm caused her horse to spook and she was thrown onto a concrete path.
Can I just have a little feel on the front of your chest, is that okay? Just tell me if it's painful when I'm pushing anywhere.
Her daughter Kelly was with her and called 999.
Where's Kelly? Yeah. I'm here, Mum. I'm here.
Rachel, I know we're asking you lots of questions at the moment, sweetheart. So, when you got up and walked from your horse, did you have any pins and needles in your arms or legs?
I can't remember.
Can't remember, okay.
Dazed and in agony, Rachel can't remember the fall. As well as low blood pressure and confusion, she's also showing an increased heart rate. All signs of potential internal bleeding.
Nothing around there?
No,
Ball in your back, okay, sweetheart.
The pins and needles sensation could be temporary, but it could be a sign of a serious injury to her spinal cord. Rachel needs urgent hospital treatment.
Let's do that blood pressure again.
But Dr. Matt knows that moving her risks leaving her paralysed.
Is that your chest again, Rachel? Yeah.
This is a patient that's jumped off the bridge, received.
That's all received, thank you.
The critical care team is available 24/7 to attend to the most serious emergencies, from road traffic accidents to cardiac arrests throughout the West Midlands.
The role's rewarding, I think it's because it is challenging.
It's without doubt a huge privilege to do this job and to have this skill set and the capability to help these patients at the worst time of their lives.
Part of their training is in drugs and anaesthesia, normally only used in operating theatres and intensive care.
Just going to pop a little needle into your arm so we can give you some pain relief, OK?
So in the most critical cases, they can take over the basic functions of the body to keep their patients alive until they get to hospital.
We can obviously put people into medically induced comas and stuff to help manage them.
If we have a cardiac arrest and then manage to get a pulse back on a patient, we carry some extra bits and pieces and drugs that we can add to what the crews do to give the patients a better chance of survival to hospital.
Critical care paramedic Jack Lewis is about to start a 12-hour shift.
It's a drug check day, so all of the enhanced care drugs are bags, because if we all turn up at the same job, we all know what's in all the bags, where it all is. It just makes life a little bit easier.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious?
Yes.
Ma'am, what's the problem?
He's really struggling to breathe. He's just literally come on really fast. He's absolutely blue here.
Okay.
All right, okay.
Is he still breathing?
Only just. He's gone all stiff on me now.
Is he taking regular breaths at the moment?
No. Dropping at the mouth.
Is he having a seizure?
I think he's having a seizure.
Okay. Let him go with it.
Come on, Dad. Okay, they're coming now, darling. Okay, I've got no breathing.
Okay, roll him onto his back for me. I'm going to tell you how to give life support. They are pulling up outside, but you need to start this, okay? One hand flat in the centre of his chest, put your other hand on top, lock your fingers together. Keep your arms straight, push down, hard and fast, 2 times a second.
Yeah.
I want you to do that until the crew are right with you, okay?
I know.
You're doing a really good job. You're doing really, really well.
Okay, they're here.
An out-of-hospital cardiac arrest is always a code-red emergency. Without swift action, the man, 79-year-old David, could die in minutes. The local ambulance crew has called for immediate critical care backup.
This is a crew request for assistance for an elderly man. I think the call initially came through as fitting, but is, I believe, now cardiac arrest. And I think they're struggling with some airway management options, which is one of the skills, enhanced skills that we carry.
Thanks to his daughter's prompt action and the crew's response, David's heart is beating again, but without enough oxygen, his life is hanging by a thread. Jack carries drugs and resuscitation equipment that could save his life, but he's still 5 minutes away from the address and may not get there in time.
Downtime has been, I think, fairly considerable now. I think call time was 20 past 2 and we're now approaching 2:40, so we've had 20 minutes of potential cardiac arrest, so it might be that by the time I get there, actually we're past the point of making a meaningful difference for this gentleman and we go no further. 62. Hello mate, how you doing?
Jack arrives at the address and is immediately briefed by the paramedic team so he can lead the treatment.
We have 74-year-old David.
Hello David.
79-year-old.
Yeah.
Collapsed, daughter says his breathing went funny.
Yeah.
She started CPR. Initially querying if there was a carotid when we got here.
Yeah.
There was a gonal breathing.
Yeah.
He arrested at 14:19.
Okay.
And we got a ROSC at 14:35.
Nice one.
Daughter Caroline, who was with him when he collapsed, has been joined by other concerned family members.
Awesome job.
The paramedics have inserted a tube into David's throat, and he is now breathing with the help of a ventilator.
I'm just going to get some midazolam, and then at that point we'll put him onto my ventilator because it's just a bit better for him, if that's okay.
Jack needs to get David to hospital for urgent tests to find out the cause of his cardiac arrest.
All right, Dad. Nearly done.
But for now, he's focused on just keeping him alive.
David's doing really, really well.
When we get him on the ambulance, we'll just have a few minutes, we'll get him sorted.
Back in Smethwick, critical care paramedics Mike Andrews and Pete Edwards are at the scene of a road traffic accident where a 13-year-old boy has a serious head injury after being run over on the way to school.
Just looking at the car for some indicators of how hard the car has hit him and potentially for injury patterns, really. So where he's obviously gone onto the bonnet, but the windscreen is intact. So he's got a head injury and some bleeding from his ear, so we need to look at that quite quickly.
It's likely Patrick's head would have taken the main impact of the blow, potentially fracturing his skull.
Patrick, do you think you were knocked unconscious at all? No. All right, mate, just have a look, just a second.
Checking his pupil's reaction to light will show whether he has suffered a concussion.
Have you got any pins and needles anywhere? No. OK. All right. How bad is the pain at the moment? Your ear, is that the worst pain? And what about your shoulder? Is it just when you move it? OK, all right, no problem. The ambulance is here now. What we're going to do, we're going to get a proper look at you in there, all right?
Pedestrian, 13-year-old male, struck by a car.
As West Midlands ambulance crew arrive on scene, Mike updates the critical care trauma desk on Patrick's condition.
Query basal skull fracture. Well, the patient is conscious and talking to us. He's just got a bit of a hemorrhage coming from his right ear.
Now the ambulance is here, they need to get Patrick to hospital as quickly as possible.
He's got a head injury. I think we need to, we'll get him immobilised. Yeah. So if you could grab your stretcher and scoop. We haven't stripped him off because he's going to get freezing cold.
Yeah.
So are you all right with that? Is that OK? All right.
Let's do a few little checks on you, OK? See how you're doing.
Peter and Mike need to be sure they don't aggravate any undetected injuries when they move him.
I think without the collar, yeah, but what we'll do, we'll get us, he's moving it, just keep your head nice and still, Patrick, that's it. He's moving his head freely and he's moving all his limbs free, he's got no paralysis. We'll have to get this bag off, I think, so it might be just a case, we'll have a look at that in a second. Has anybody got any shears on them?
Keeping Patrick as still as possible, Pete oversees the ambulance crew as they position the scoop stretcher underneath him.
Any pain in your tummy? Nothing? No in your back? Lower back? That's good stuff. OK. Right. Just let us do all the work, Patrick. OK. We're going to just... There's going to be a little bit of movement, mate.
You're going to feel pinch and sneeze, all right with this?
All right. Now, it might pinch your bum. Tell us if it does and we'll stop.
You got his head just clear of that, mate.
Once the two halves are snapped together, Patrick's head and neck must be immobilised.
Yep. OK, mate.
Before it is safe to move him onto the stretcher.
Got some grazing to the temporal region there. The other thing we need to have a look at is his sort of upper thigh pelvis region, because where the dent is on the bonnet, it looks like that's where it's struck him. Yeah, if that makes sense. So, ready, steady, lift, and ready, steady, down. OK. So that's, you're right. All right, nothing to worry about, we're going to look after you, OK? OK, going feet first, then. What we're going to do, we're going to take some of his clothes off, all right? Yeah.
On the ambulance, Pete can oversee a full body examination. He's worried Patrick may have broken a bone in his pelvis, which could rupture the femoral artery, causing him to bleed out and die.
Take a nice big deep breath in for me. Big deep breaths in. It's clear. It's equal. OK. So I've checked his pupils, they were leaking and active right. He's got an abrasion to the top of his the right side of his forehead, and he's got this blood coming out of his ear that I can't see where it's coming from. So in terms of hospitals from here, he's nice and stable, but just because there's blood out the ear, I think sway towards the children's. What do you think?
Patrick is alert and doesn't seem to have broken any bones. Pete is happy he is stable enough to leave him in the care of the ambulance crew to take him to Birmingham Children's Hospital to be further assessed by the emergency doctors. It's the weekend, but there's no let-up in life-threatening emergencies and no rest for the critical care team.
2020.
Critical care paramedic Tom Waters is prepping for his shift.
Saturdays, obviously, more people are off, more people want to do certain things, people are more active. So yeah, I think that could mean a busier day for us. The weather, it's not too bad outside, so we'll see how the day goes, but we're booked on, we're good to go. We've got our drugs out, and it's a bit of a waiting game now.
Ambulance service, is a patient breathing?
Hi, I'm not sure. Literally just seen a crash outside of our house. The car's literally like written off.
Okay, so it's one car. Oh,
Yes, it's one car who's gone into like the wall.
Did you see how fast the car was travelling at all?
It was going quite fast to be honest. Like more than 50.
That's absolutely fine. I am going to be on scene in 30 seconds.
Thank you.
With a car crash in a residential area, there's the danger of multiple casualties. Police, fire brigade and ambulance have been called, and specialist trauma backup is also requested.
RTC, don't really know what's going on, but it's here.
At the scene, a crowd has gathered on the pavement.
Oh shit.
The vehicle, a rental car, has somersaulted into a brick wall and the driver is nowhere to be seen.
Which way did this car come from, do you know? Halfway. Okay, right. And did you all see it? Okay.
Does that catch you anywhere when you breathe in?
In Wolverhampton, Dr. Matt Rowley and critical care paramedic Karen Baker have flown 9 miles in the Midlands Air Ambulance to rescue 49-year-old Rachel, who is in a critical state after she was thrown from her horse onto a concrete path.
Any pain in your tummy?
No.
Good, okay.
What were sats on there?
100%.
Okay.
It was just the fact that capillary refill was a bit swollen.
Okay. Any pain there in your tummy? No, okay.
Rachel's low blood pressure and poor circulation, along with her memory loss and severe pain in her upper back and ribs, is a sign that she may be suffering from life-threatening internal bleeding.
Do you want to take the mask off it now and just see how she's saturating without the mask?
What we're going to do is just have a little feel underneath your neck at the moment, okay?
On the left, you know, on the left part of my neck.
Yeah.
If where the ball is, I've hit there as well.
Have you? Okay.
Yeah.
When I'm pushing now on your neck, tell me if you got...
Tiny. No, gone now.
Okay.
There.
There, is that tender in the middle of your neck? Is it where my finger is there? Okay.
Rachel needs urgent hospital treatment, but before Matt allows her to be moved, he needs to be sure she hasn't fractured any vertebrae, which could result in paralysis.
How much morphine she had off your time? Just 5. Should we go for let's go for another 5, and then we can give her another 10 then, can't we? She had any antiemetics yet either?
Yes,
she's had the on-dance charge. Examination's fine. Let's give her a bit more opiates and see how we get on.
Dr. Matt judges the precise dose of analgesia Rachel needs to help her tolerate the journey to hospital without risking a drop in blood pressure that could cause her to black out again.
She'd be good for New Cross.
I agree with you. I think New Cross, you might have something in the right chest. I think we're so close. I don't think she probably warrants giving anything stronger like ketamine or anything.
It's a 9-minute journey to New Cross Hospital. Rachel will travel in the ambulance with her head and neck immobilised in a collar to protect it from any further damage.
Rachel, if your pain was a 10 at the start, where are we now, do you think? About a 3? Okay.
Blood pressure before I get this, so
just give her another 2.5 or something. She's quite comfy, isn't she now? So, initially assessed her on scene. They've been slightly concerned because she's quite pale. Her initial blood pressure is a bit low, and she's got significant pain on the right side of her chest when they're breathing in and out. So, quite rightly, they've been fairly cautious with the analgesia that they're given to start with. Her observations have improved, and that's enabled us to give more morphine.
Right, I am going to go and start loading the motor back up.
Okay.
With Rachel's condition now stable and her pain under control, Matt and Karen leave the ambulance crew to transfer her to hospital.
She's now fairly settled. She's able to take big, deep breaths in and out, and the pain has subsided slightly. So they're going to take her to the nearest hospital from here.
Hiya. I guess it's...
In Dudley, critical care paramedic Tom Waters is at the scene of a road traffic accident.
Hi, buddy, you all right?
Yeah, I'm okay, mate. It's just a few bumps and bruises.
The car somersaulted off the road into a lamppost. Miraculously, the driver, 39-year-old Carl, walked free from the wreckage and is being treated inside the ambulance.
The car is absolutely total, isn't it? It's been through a massive roll, isn't it?
Yeah. And then men flipped like that as well, yeah.
And it was just you in the car,
Just
wasn't it?
me in the car.
And if you hit, I'll go check nobody else has been hit, all right, and then...
According to Carl, the accident happened when he was run off the road by another driver.
Are you happy for me to... He looks absolutely fine, doesn't he?
I don't
like the fact... Yeah, so the fact he's self-extricated, he's walked, he's chatting, his G says 15, he remembers it all. If anything, he can go to low... Oh, there you go. Hey, bud. Are you getting your phone? All right.
Extraordinarily, Carl seems most anxious about his mobile phone.
So basically, the one gentleman is the... he's just getting his bits and pieces out of the car.
Well, how's he done this?
Long story short, rammed off the road, hell of a mechanism. He just wanted to check his stuff, so... All right, bud. Do you want me to have a look for you?
Yeah,
do you want... Yeah, go and have... We'll get... Yeah. Go and have a sit down in the... Take those bits for you.
My phone is in there, it's
okay.
On a 20i light.
Okay, well, we'll make sure we get...
I just need to get it because my mum was on
okay.
trying to ring me while this was happening.
Let the guys just safe it. We'll get it for you. Go and sit in the ambulance. Cheers.
Can I get the phone though before?
Yeah. We'll ask one of those guys. We'll get you the phone. I promise you. But can we get you inside first? What's the... Bloody lucky, isn't he? Yeah. He's really desperate for his phone.
Satisfied that Carl has not been seriously injured, Tom is happy to leave him in the care of the local ambulance crew. In Birmingham, critical care paramedic Jack is treating 79-year-old David, who is fighting for his life after a 15-minute cardiac arrest. Daughter Caroline and other worried family members are also on scene.
So he's had a cardiac arrest. He's had a cardiac arrest that's been prolonged for quite a period of time. Because of that, his brain's been starved of oxygen, even with good CPR. So it's likely that if he starts to try and come around too much, he's going to be very agitated and quite difficult to look after.
As a highly trained paramedic, Jack is authorised to use specialised drugs normally only used by doctors in intensive care in hospital.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing, all of his awareness.
With David barely conscious, Jack must decide whether to put him into an induced coma to protect the vital supply of oxygen to his brain and organs.
OK, so he's had 3 milligrams of midazolam. He's had that now at 14:48.
If he has another cardiac arrest while he is under full sedation, it will be much more difficult to resuscitate him and he may die.
Yeah, so eyes are open, but he's not really responding to you. He's localising, so that's a 5. Yeah. Ben, can I have a conference call, please, with senior cover to discuss some rock?
Rocuronium bromide is a fast-acting muscle relaxant normally used in operating theatres before major surgery.
Hi, Neil, you OK? Good. Thanks, mate. So I've got a 79-year-old gentleman who's had a witnessed cardiac arrest at home.
Jack wants to consult with the senior doctor on call before he decides whether to go ahead and use it.
Giving him a small amount of midaz, so 3 milligrams, just to try and flatten him out a little bit. So the call is to discuss potentially to add rock over the top of that to facilitate kind of a safe extrication and get him off to hospital. Let's try the SIMV first, no problem. Yep, sounds good to me. Thank you very so much, Neil. Have a good day. Take care. Bye-bye.
For now, Jack will keep David on the ventilator at his current level of sedation.
Have you got a full cylinder there, guys, or a nearly full cylinder?
We've got a spare one on the other side.
Perfect. So if we pop that on the where yours is, yep. So what this will do is it will support the breaths he makes, and it'll add a coupling over the top. I'm happy if we want to just break the scoop and we'll start sliding it underneath and get him packaged, but we'll obviously just keep it nice and steady, keep a close eye on him. Looks like he's fighting it a little bit, isn't he?
It's common for someone who has suffered a cardiac arrest and been resuscitated to re-arrest again on the way to hospital.
We'll get him strapped and packaged, we'll do one last check, and if we're happy, we'll extricate him out to the stretcher, get him onto the ambulance, reassess him there. The way he's going, I probably will end up giving him some rock on the back of the vehicle and just making sure we're settled for the transfer. But if you're happy now, we'll get him out. I'll grab the vent and the monitor. 1, 2, 3. OK, just watch out for all this. Is nice, slow time. If you keep coming forward, we'll get out behind you. Nice and high there. So just grab make sure I've got the little yellow handbaggy thing with the drugs in it, which should be on the chair, and the red bag. Is that all right? Thank you. All right? Nice and slow.
On board the ambulance, Jack makes his final checks.
That's right, so we've got airway. We've got IGL size 4 on a circuit that's working. He seems to be tolerating it fairly well. I'm not convinced that he's not making very effective rasps. He is breathing for himself, but they're not particularly strong. On that basis, I would feel more comfortable taking over and giving him the rock.
7.8, I think it was.
Having weighed up the risks, Jack decides the safest course is to take over David's breathing entirely.
So once I give him this, obviously he won't make any movement, he won't breathe for himself, but it's really important that we keep an eye out for things like tearing, tachycardias, and a raise in his blood pressure, because those are things that are going to indicate maybe some awareness. OK, so I'm going to give him the rock now.
Once the neuromuscular agent has taken effect, David is now effectively in intensive care conditions. His body unable even to breathe by itself.
60, thank you. We're about to leave for Heartlands. If you're ready for an atmist. He has now had, in total, 8 milligrams of midazolam, and I've given him the 50 of rock, because he was struggling to fully synchronise with the ventilator in the end.
Before they set off to hospital, Jack updates the trauma desk on David's condition.
We will be 8 minutes to Heartlands received.
Yeah, sorry, 8 minutes to Heartlands.
That is affirmative.
Leaving one of the ambulance crew members to drive his vehicle, Jack will not leave David's side until they arrive at hospital.
All right, David.
Well done, David.
We're off to the hospital, sir. So just become a little bit hypertensive again. So we just want to make sure that that's not any awareness. He's not becoming tacky.
En route, Jack and the ambulance paramedics keep David under close observation. The slightest fluctuation in his blood pressure could be a sign that his heart is about to stop beating.
You've got some global ischemia, but that's normal, that's for reperfusion, so I'm happy with that.
Arriving at hospital, Jack can deliver his critically ill patient to the waiting cardiac team in intensive care.
Skills that we provided there were the sedation, the advanced ventilation, the paralysis, the management of that post-ROS patient who's potentially very unstable, although he did quite well, and make sure that he was handed over effectively ready for ITU. So we had an airway in place. He wasn't aware of what's going on, he wasn't distressed, he wasn't in pain, and we were able to effectively put him onto an advanced ventilator and ensure that his physiological needs are taken care of. The plan now, hopefully, will be to head back to base, restock, maybe have a cup of tea, but we've still got a couple of hours left of the shift, so I could end up going to anything in that period of time. We're just hoping for a slightly more sedate last few hours, but we'll see what comes through.
The critical care team in the West Midlands are on the road 24/7, 365 days a year.
No problem at all.
At night, the car is crewed by a hospital doctor and a critical care paramedic.
Do you know any raps? Yo, my name is Tom and I'm very woolly.
I'm a bit of a bully, yeah.
Oh, perhaps not that one.
Dr. Tom Woolley is a hospital doctor who works 16 shifts a month for the critical care team. Ryan James is a full-time critical care paramedic, working an average 4 shifts a week, day and night.
I think I'd struggle to work within a hospital environment, certainly in the winter months. You go into work, it's dark, you spend all day under artificial light.
And you don't get to go to these fine dining establishments.
No, you don't get to go to the chicken outlets.
Ambulance service, is the patient breathing?
Yes, it's me. I don't feel my foot's hanging off. Blood everywhere. My foot's just, it's just detached. I can feel the bone sticking through.
All right, we're not far now, okay? A couple of minutes.
In Walsall, Dr. Tom Woolley and paramedic Ryan James are en route to a code red emergency.
We're going to a 71-year-old lady with what sounds like an open ankle fracture, so there's break to the skin. There's a paramedic crew on scene, and they've asked us to come and assist with them.
Open or compound fractures can have serious complications and need urgent treatment. Wounds are easily infected, and disrupted blood flow can cause long-term damage to limbs.
Just ahead, keep left.
Tom and Ryan are only 2 miles away.
If it's a really nasty, deformed ankle fracture and she hasn't got any pulses in her foot, that might be another reason why they might want to call us to try and realign the fracture.
6 minutes later, Tom and Ryan are on scene.
Reached your destination.
Gloves.
Hello. Hello.
Hello. What's your name?
Sandra.
Sandra.
Hi, Sandra.
Can I have a little look at your foot, okay?
71-year-old Sandra has broken the 2 biggest bones in her ankle.
That's a decent fracture, that is, isn't it?
The snapped shards of her tibia and fibia have speared straight through her flesh.
I remember getting across the floor, and all of a sudden my foot was hanging off.
She had a mechanical fall, 6 o'clock.
Yeah.
She managed to crawl out of there,
Yeah.
so call 999, then call back.
Sandra was in such agony after her fall, it took her 2 hours to drag herself across the floor to reach the phone for help.
Sandra,
Yes?
can you feel me touching your foot there? You can.
It's a horrific injury, but Tom is concerned there may also be unseen damage to her nerves, and that could result in her losing the foot.
How's she coping with the Entonox?
Sandra's been given gas and air for immediate pain relief.
Just hold on to that, pop it on your face, and just take slow, steady, deep breaths, OK? Make a full seal.
But what Ryan and Tom need to do next calls for something much stronger.
And you've got IV access, have you? Yeah, and that's working all right, is it?
About a third attempt. Do some of the good stuff as well, Jill.
Before they can move her off the floor, Sandra's shattered ankle must be realigned. So Ryan gives her liquid morphine to help dull the agonising pain as Tom pulls the bones back into place.
Sorry, Sandra. Nice deep breaths for me.
Nice deep breaths,
Well
Sandra.
done.
That's it, well done. Nice deep breaths. Nice deep breaths. Keep going.
Well done.
Doing a great job. Deep breaths, Sandra. Don't hold your breath, sweetheart. That's it. Nice, steady, in and out. Big, deep breaths. Well done. Do you want to split it off
let's
first?
do that first, yeah.
The worst part may be over, but they still have to lift the injured ankle up off the floor into a temporary splint.
Well done, Sandra. You're doing really well.
While maintaining the bones in their correct alignment.
Apologise. You're doing really
happy?
well.
Yeah,
Really
all right.
well.
OK, well done, Sandra. Well done, darling.
Sandra. Just keep taking that gas as well. Keep taking that gas.
Nice, long, deep breaths, Sandra. Well done.
Tom and Ryan now need to work with the ambulance crew to get Sandra to hospital as quickly as possible to prevent any further damage to her foot.
We'll get the stretcher in, scoop off the floor and get her on, shall we?
Yeah, yeah. Just take some breaths of normal air in between. Is it still really sore? Just a bit. OK, all right. So you just lay where you are. We're going to get you onto a stretcher. We need to get you to hospital because you've broken your ankle and it doesn't look particularly great.
the bones, it's an open fracture.
That's right, it's an open fracture.
It's been infected, is it right?
So we need to get some antibiotics into you and we need to fix it for you, okay? She's got quite a nasty looking open ankle fracture. What that means is the bone protruding. And so because it's quite a lot of damage to the skin around, we're going to take her to the QE in Birmingham, which is a major trauma centre, rather than the local hospital, just because she might need orthopaedics and plastic surgery potentially.
While Sandra gathers her strength for the next part of her ordeal.
Are we going to get around this corner?
I think we're going to struggle, to be honest with you.
Yeah.
Ryan and Tom need to work out how they're going to stretcher her out of the house.
It's getting through here, isn't it? Or back in there, because we can't even go in there, so straight in here.
What if we go blue carrier sheet and then we can get around the corner?
The only option is to bring Sandra out on a flexible plastic sheet. But the extra movement that will involve means Sandra must prepare herself for more pain.
Sandra, listen to me, sweetheart. We're going to slide you into your hallway, and then we're going to open the door, and then we're going to have to manoeuvre you a little bit out of the front door, OK?
It's fine.
Yeah.
Come towards me. Now, Pecky.
Hang on, sit up, guys. Hang on, that's it. There we go. All right. Is that OK? Do you think you'd be able to put your hands on the floor and then shuffle your bottom to the right-hand side? Do you think you'd be able to do that? Well done. Take your time. Is that OK?
That's it, well done.
Lie yourself back down now. OK.
Oh.
We're just going to put some more pain relief in your hand, all right?
Sandra's played her part brilliantly. Now it's up to the ambulance team to complete the extraction as quickly and painlessly as possible.
All right? You OK?
Yeah.
Any new pains or anything like that?
No.
OK.
OK.
Happy, Tom?
Yeah, on 3, 1, 2, 3.
You're just going to try now, all right? Bear with us. Everyone happy?
Yeah.
On slide. Ready, set, slide. OK. Well done, Sandra.
OK, we're clear.
You OK? Keep your head up, sweetheart.
That's it, well done.
OK.
Yeah.
Right, shall we lower down there, everyone? Yeah. And we'll just pop her on the stretcher. On lift, everyone. Ready, set, lift. OK, walk forward. Keep coming, keep coming, keep coming. And lower there. Well done, Sandra.
It took 10 milligrams of morphine, some gas and air, and a lot of courage on her part, but Sandra is now safely on the ambulance.
Nice to meet you, Sandra.
Yeah.
I'm getting off now. This gentleman's going to look after you. Nice to meet you, chap. Catch you later.
Knowing their patient is in a stable condition, Tom and Ryan are happy to leave her in the care of the crew for the 14-mile journey to hospital.
The ambulance crew will take Sandra to the QE. They'll hand her over to the emergency department there, and the emergency doctors will then speak to the orthopaedic team about admitting her to hospital for further treatment and probably need surgery on that ankle.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
ETA 4 minutes.
a man is crushed beneath a quarter-ton engine.
Fire will be there to get the engine off his legs over.
On the top floor in the top corner here.
A cardiac arrest on a squash court.
Onto your back, John. Sorry, mate.
A DIY disaster.
Isolated abdominal injury with partly eviscerated bowel. Hold on to my hand.
And a passenger is trapped after a serious car crash.
Have you got some morphine to draw up? I think he's going to need it no matter what, isn't he?
The critical care team was formed with one aim: to save more lives. Operating 24/7 and crewed by highly qualified doctors and paramedics, their fleet of vehicles are prepped with life-saving equipment and ready to scramble at a moment's notice.
What day is it? It's Sunday. It's 7 o'clock in the morning.
32-year-old critical care paramedic Tom Waters is about to start a 12-hour shift.
We check all our kit every day, so then nothing gets missed out. I like to just make sure everything's in its special place. It all gets used on a daily basis, so make sure nothing's missing.
After working in the ambulance service for 6 years, Tom underwent 18-month specialised drugs and life-saving skills training to become a critical care paramedic.
In ambulance, traditionally, we'd only see a major trauma patient or someone who's suffered a significant car accident or whose heart has stopped beating maybe once or twice a year, where our job is to deal with cardiac arrests, major trauma patients on a daily, regular basis.
Ambulance service, is the patient breathing?
Yes, yes,
and
but the person's on the floor.
Awake?
Yes, but the person has cut the belly.
Have they fallen? They've put
Yeah, they're
themselves
on
with
the
a
ground.
chainsaw. Are they able to speak to me?
No. Oh my God,
Okay.
everything's out.
His intestines.
Yeah.
Has he lost enough blood to fill 2 mugs?
Yes, a lot. Please, just come.
We're coming on blue lights and sirens, so we're going to be there as quickly as we can.
It looks like a 43-year-old male who has sustained an abdominal injury from a chainsaw, and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, you're right. Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa, is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you
Right then. That doesn't look too bad.
It looks like it's adipose tissue
Yeah.
or anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around it will stick to it a little bit. And then, if I can get you guys to put some tape around that, is that all right?
Just going to stick the dressing down, Raphael, okay, just to keep it clean.
Okay, so this gentleman, age, I believe you already know. He's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bowel.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling? Sam, can you get some IV access? Is that all right?
Traffic element 03 Alpha's road to start recall 4 PRB and heading east and towards...
The most serious emergencies require a doctor-led trauma response. The Midlands Air Ambulance can fly a hospital doctor and critical care paramedic to 90% of the region within 8 minutes, delivering advanced life-saving care to the roadside and fast transfer back to hospital.
Ambulance services, the patient breathing.
Yes.
Are they conscious and awake?
Yes. Me and my husband are moving some mechanical equipment around the back of our house and it fell on him and he's broken his wrist and there's like a big engine sitting on his leg.
Okay, so he's trapped under it at the moment?
Yeah.
What's it an engine from? A car or?
Yeah, a Land Rover.
Okay, sweetheart, we'll be with you as quick as we can.
So 3 got ETA 4 minutes. Have you got any details on the case, please?
Dr. Matt Rowley and critical care paramedic Karen Baker are en route to a code red emergency.
Patient in the back garden who's been working on the Land Rover's engine. It's fallen onto him, trapping his by his legs. Fire will be there in order to get the engine off his legs over.
A man is lying crushed beneath 1/4 of a ton of cast iron. The range of potential injuries are so severe, the critical care team have been scrambled.
Our point of view would be go, do an assessment, look at his airway, breathing, circulation, and see if there's any immediate interventions we need to perform that may be life-threatening to him.
Helimed is above the house within minutes.
Okay, you think I've got, fire service. Just coming down the right-hand side there. So it looks like this field here is going to be about the nearest. There's horses in that, unfortunately. We're just looking if there's anything in that.
Yeah, that's fine. Yeah,
okay, cool. We'll go with that.
A paramedic working on a regular ambulance will only see a couple of major trauma incidents a year.
All good on the left-hand castle.
Yeah, all good.
Thank you very much.
But these guys deal with the most critical emergencies every day of the week.
There's a catch there.
03 on the ground.
It's now been 15 minutes since the 999 call came through. Matt and Karen are concerned the longer the man is trapped under the machinery, the more damage is being done.
If they've managed to get it off quite quickly, then we'll be looking at some soft tissue damage and fractures. If it's stayed on his legs, how long it's crushed his legs for, because then you get problems with circulation.
Hello.
How are we doing? You all right?
Says you can feel it, obviously it hurts.
Yeah.
Arriving on scene, Matt and Karen are quickly briefed by the fire service and a local ambulance crew before they can take control of the rescue.
He has got a collis fracture on his left wrist as well.
Okay.
So we're just in the process of getting the engine off.
Okay. What's your name, fella?
Dave.
Dave. My name's Matt, one of the doctors off their ambulance. All right.
Scrapyard manager and Land Rover enthusiast Dave Evans was renovating one of his old vehicles when the heaviest part, the engine block, fell off the workbench.
Can we get you back on this gas and air?
Dave tried to stop the fall, but the huge weight was too much, breaking the bones in his wrist.
And it's just toppled over onto him from there, has it? Presumably.
The ambulance crew have splinted Dave's broken wrist and given him gas and air and intravenous morphine to help him deal with the pain.
How's he doing with the morphine?
Although Dave appears calm, Karen is worried about the potential injuries to his leg that they can't see.
Is it from the lower leg?
What I can only see just around the knee, I can't see below.
Has he got a distal sensation?
Karen is worried the engine could be restricting the blood supply down his leg. This could lead to Dave losing his foot. It's essential they get the weight off before it's too late. The critical care team cover an area of 5,000 square miles in the West Midlands with a population of 5.6 million people.
Ambulance service is a patient breathing.
Every day, the ambulance service receives around 4,000 emergency calls. But when the call is critical and there's every chance the patient won't make it, that's when the trauma specialists are needed.
Going to the big job now. See you later.
The #1 call out is to people whose heart has stopped pumping effectively and gone into cardiac arrest.
Pulling through a big cardiac arrest in the street.
Yeah, that's all received. We're showing about 7 minutes away.
Every minute the patient's in cardiac arrest, their chance of survival decreased by about 11%. So the quicker someone starts CPR, the more likely it is that the patient will survive neurologically intact.
Obviously, we're hoping when we go to cardiac arrest that we can get an output back. We've got the Lucas device which we can use, and we've also got drugs that we can give, medication, which obviously increases their chances of survival.
Ambulance service patient breathing.
No, it was someone who's playing on the court next to us. There's stuff around him and they're doing CPR.
Right. I know that they've got access to a defib then. I presume one of the staff members got it.
Yeah,
they have. Okay, right, we are coming as quickly as we can, okay.
A 72-year-old collapsing with a sudden cardiac arrest is an immediate code red emergency.
Red.
2 local ambulance crews have already been dispatched to the scene. But as fewer than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive, 28-year-old critical care paramedic Aidan is also en route.
The AED's being used, 1 shot's being delivered.
Excellent, thanks bud.
A bystander has managed to restart the man's heart with a defibrillator, but it could re-arrest at any moment.
I'll go Lucas in hand.
The Lucas chest compression system allows Aidan to continue resuscitation mechanically even while on the move. It's a vital bit of life-saving kit for the critical care team.
Looks like it's in a squashed court on the top floor.
Arriving at the sports centre, it's now 20 minutes since the call came through.
Excuse me, upstairs?
Yeah, absolutely. It's up on the top floor in the top corner, yeah.
Thank you.
When a person has suffered a cardiac arrest, time is critical. Every minute the brain is starved of oxygen, there is a greater risk of stroke and long-term brain damage.
Hello. How are you doing, everyone? All right? How are you doing? Hello, how are you doing?
4 paramedics are already treating 72-year-old John.
Went to hit the squash ball, collapsed, fell flat on his face. The gentleman over there gave him mouth to mouth, chest compression.
Yeah.
He started breathing again.
His condition was so serious, it took staff at the sports club 6 minutes and 3 attempts with a defibrillator to get his heart started again.
Has he got chest pain or anything at the moment?
He has got chest pain like global all over.
Okay.
It's loose, very heavy.
The paramedics have put John on an oxygen mask and hooked him up to an electrocardiogram to give an accurate reading of how well his heart is functioning after the cardiac arrest.
We'll just sit him onto his bum, stand up on his feet, stretch him behind him. Onto your back, John.
Taking charge of the scene, Aidan needs to get John off the floor, onto a stretcher and into hospital.
Alright, what's happening? Where's that pain?
If he has a second cardiac arrest, it's his best chance of survival.
When you guys got here, he was GCS 15, a bit agitated, but he was conscious and stuff.
No, he was very combative, he couldn't talk.
Okay, let's just shave all this off for a second where we can, and then get the pads on. It's obviously a high chance of re-arresting now.
Although John is conscious, his brain was deprived of oxygen for 6 minutes. It's left him confused.
John?
Yeah.
Where's that hurting, mate?
Yeah.
In your chest?
Yeah.
OK. Does it feel like you've hurt something as you've fallen?
I don't know.
You don't know? OK.
You fell first.
John, are you listening? So, I know that's really painful. We've got to get you up off the floor in order to get you into the ambulance and off to hospital. So bear with us. Let us help you. Just wait a second.
These chest pains are a sign of restricted blood flow to the heart. It's a clear warning that he is in danger of suffering another cardiac arrest.
Match me right. First of all, John, just sit up for us. Not stand, just sit for a second. All right, just wait there. After 3, then, John. 1, 2, 3, push. Just have a seat on there.
Sit down, John.
Right, relax your head down to the right. Down to the right. We'll swing your legs up. 1, 2, 3. There we go. Just square yourself up into the middle for us, John. OK.
Having got John onto the stretcher, Aidan is able to manage his airway and restart chest compressions if necessary.
So he's not had any medication or anything yet? No. Lovely. I'm just going to give you a bit of a spray in your mouth. Might make you feel a little bit lightheaded, a little bit dizzy. If it does, just let us know. OK? Your tongue up for me. Lovely. And pop this in your mouth and just chew that around for me.
Aidan gives John a nitroglycerine spray to expand his blood vessels and an aspirin pill to thin the blood to increase the flow around his heart. Now he's ready to start the journey to hospital.
Was it yourself who did the CPR?
There's a few people.
Well, you guys absolutely saved this man's life, so you should go home very happy. Well done. Thank you very much. Guys, nice and steady. Just slow it down just a bit.
Leaving his vehicle at the gym, Aidan will travel with John in the ambulance in case he has another cardiac arrest en route.
Right, it's going to be a bit bumpy, OK?
He won't leave his side until he's safely delivered to hospital.
Nice and steady there.
He's had operation, yeah?
Yes, he will need to.
In Walsall, critical care paramedic Tom is treating 43-year-old Rafa. He needs urgent hospital treatment following a DIY accident with an electric saw that's cut open his abdomen.
Right, we're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
Right, just put him forward. I just want to check his back while we're here.
Yeah.
It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on a ladder. He was doing something around this thing.
Yeah.
And, yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, I don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details for as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we're trying to obviously avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk?
No.
OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance,
Yeah.
keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. OK, so up you come. So, at the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've dressed it. We're going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, okay, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
In an average 12 hours, Tom will attend around 8 life-threatening emergencies, testing his techniques, drugs and specialised equipment to the limit in some very challenging environments.
I've obviously seen the worst in people and the best in people, but I've never really had an issue of taking it home. I've got a very small baby and a fiance, and that pretty much fills my life in the evenings, so. There are days where you have jobs which you get flashbacks. You know, at worst, it's always children, isn't it? But fortunately, I seem to manage quite well with that. I feel like I'm relatively thick-skinned.
For Tom, there's no such thing as a quiet shift, and there's never long to wait after the end of one job until he's needed again. An ambulance has been dispatched to an address in Dudley for a code red emergency involving a seriously ill child, and they've requested critical care backup.
5 minutes away, and we don't know too much information, but we think it's a 10-year-old who's not very well.
Sick children can go downhill very fast. A sudden onset of disease can easily overwhelm their body's vital systems, so early diagnosis is paramount.
Assessments of children are generally really hard, and there's always things that can get missed.
He arrives on scene 14 minutes later.
I went in through the side.
The paramedics have already moved the child into the ambulance.
Hey, buddy, you're gonna be sick. Can we have your arm? All right.
It's every paramedic's worst nightmare.
All right.
The boy is presenting advanced symptoms of one of the most deadly childhood diseases.
I think that kid's got meningitis.
Let's come off the oxygen just for a minute, guys. We'll just come off the oxygen.
In Wolverhampton, critical care paramedic Aidan is battling to keep 72-year-old John alive and breathing after he had a cardiac arrest while playing a game of squash.
Sorry, mate. Relax. If someone's got some morphine on this truck, if someone can draw some morphine up, if that's okay. And then we'll work on just getting a posterior ECG, see whether we can get him straight to PCI.
John was without oxygen for 6 minutes before gym staff restarted his heart, which left him confused. But 27 minutes later, he is starting to become more lucid.
John, so I think something's happened to your heart. Okay, so we're going to be taking you to hospital shortly. Okay, you've had a collapse whilst playing squash. Yeah. We'll take good care of you. All right. Okay. Have you ever had a heart attack or anything like that before?
I had a murmur once.
A murmur. Okay, you never had surgery on your heart?
No.
No, okay.
It's now 33 minutes since John collapsed.
Right, John.
Yeah.
We're just taking a little scan of your heart.
Okay.
We need you to stay really still for a second. Okay, nice and still for us.
Aidan needs to run a second ECG to try and find the cause of John's cardiac arrest.
Just 2 seconds. Is that a good trace? It's all right?
Yeah.
Yeah. So, guys, we'll head off in just a second. If it's OK, just have someone can drive my vehicle. I could do with somebody else in the back, though, just in case he has another arrest. Yeah, just nice and steady, bud. That'd be great. And there's just going to be a little scratch on your hand, OK?
En route to hospital, John is given 2.5 milligrams of morphine a fast-acting painkiller to help make his journey more bearable.
So, John, we're going to New Cross Hospital at the moment. Obviously, we think there might be something a little bit wrong with your heart at the moment, okay, which has caused you to have this collapse. Okay, so when we get to the hospital, there's going to be quite a few people there who are going to want to speak to you and ask you some questions, okay? We'll take good care of you, okay? You say you're winning the game of squash. Are you sure? Do you normally win against this chap? It looked like an elderly gentleman.
So he ain't playing with you again?
No, I've been playing
40 years?
Yeah.
Crikey. You should be all right by now, then.
I'm struggling to remember what that is.
You've had a period where you've lost consciousness. Yeah. So that would be expected.
Right.
Yeah.
6 minutes later, they arrive at New Cross Hospital, where Aidan delivers his patient safely into the care of the waiting cardiac specialists. For John, it's been a lucky escape.
Obviously had a cardiac arrest, a really serious situation. We're probably in the best situation that we could be now, considering he's had this cardiac arrest. So he's now relatively stable, his heart's beating okay, he's breathing. So they're going to do a few more tests to see exactly what it is which has gone wrong with his heart and treat him appropriately from there. So really happy, really good outcome, and just emphasising the importance of bystander CPR and community access defibrillators, which undoubtedly saved this gentleman's life. So yeah, really good.
Right. 12 miles away in Stourbridge, Dr. Matt Rowley and critical care paramedic Karen Baker are on scene with 40-year-old Dave, whose leg has been trapped under a 1/4 of a ton of Land Rover engine for the past 35 minutes. Every second counts, because without proper circulation, there's a real risk that the leg won't recover and it will have to be amputated.
The leg can just go ischemic. You cut off the oxygen supply, and then that builds up toxins. And then, of course, when it's released, those toxins can then go into the main circulation.
The fire brigade are trying to free Dave using hydraulic lifting equipment, but without a clear view of his trapped leg, it's hard to get the machinery into the correct position without risking even more traumatic injuries.
Right, that's it. Really slow, deep breaths now.
He's had 15 milligrams of morphine and continues to take gas and air to deal with the intense pain.
Right, let me hold it. Good man, that's it. And again. Deep breaths.
With the lift now in position, the firefighters and medics work together.
Just tapping me, Paul. My leg's loose now. Just refresh.
Good. Deep breaths, Chris. We're supposed to do this, mate. Go on.
Right, sorry.
Deep breaths, I say, well done.
Oh! Right, hang on.
Hold it, Chris. Just hold it there.
Yeah, you're going to help yourself, sir, with your right? Yeah, go on, forward. Okay. Go on, forward. Reduce. Go on,
Smash
go
it.
on. Go on. Go on.
Well done.
There we go. Go on.
With Dave's leg finally free, Matt and Karen can assess how badly it's been damaged.
Good man, let's have a little look at it.
How's your pain now that you've come out?
Just because my foot's being pushed, but I don't feel like it's broke. My wrist is definitely broke.
Yeah. Are you tolerating the pain at the moment?
Yeah.
That's a lot better.
My leg feels fine.
Good.
That's very good.
Your toes a bit blue then.
Give your toes a wiggle. Good man. Well done.
Miraculously, despite being trapped under a 1/4 of a ton of cast iron, Dave appears to have escaped with just some painful bruising.
Shall we get your chair, do you think? Yeah. We'll pop him in a chair and go over the back.
She gets to shout at you now. You're all right.
You'll just have to do it in the house next time, won't you, where it's dry? Be all right. He's been very lucky. It's just sort of pinned his leg to the floor. He's got no serious injuries. People can come off much worse if it had fallen on his femur, his pelvis, his abdomen, his chest. You know, his injuries could have been far more significant.
Dave is being taken to hospital by the ambulance crew, leaving Matt and Karen clear to respond to the next emergency. Over in Dudley, critical care paramedic Tom has just arrived on scene, where a young boy is critically ill.
Are you going to be sick? Can we have you around? All right.
He is displaying symptoms of meningitis septicemia, a rare bacterial infection that kills 10% of children who catch it.
Oh, bless him. And sorry, he's 10 years old, isn't he?
Yeah, 10.
Okay.
10-year-old Harry was sent home from school yesterday with what seemed like a vomiting bug. Now a rash has started to spread across his body.
See you in a bit, Harry. Your mum's coming forward with you, okay?
A dangerous sign the disease is advancing fast.
I am 1.2 grams, dissolved in 4 mils, 1.2 grams, 4 mils.
Tom knows if his diagnosis is correct, he doesn't have long to get the infection under control before it enters Harry's bloodstream, where he won't be able to halt it.
Well done, Harry. Very brave.
We're going to give him an injection into his arm as well. He's going to have 2 injections, if that's all right.
Tom will need to administer the potentially life-saving antibiotic there and then before they get to hospital.
Well done, buddy.
With a son's life hanging in the balance, Harry's mother Laura can only stand by and watch.
Okay, bud. That's the first one. Go ahead.
Hi, Tom, sorry, Bobby. Just wondered if you had any clinical update whether you required it.
Yes, it's got quite a significant rash along his body. Reduced ECS. Given to Ben Pen now.
What's the actual copy of the speech of it?
So that's
600.
600.
Yeah, so he's having 1.2.
Right, then we get ready to go. Are you ready, mate?
Tom knows it's critical they get Harry to hospital as quickly as possible, where he has the best chance of recovery.
Do you want me? How about if I do the pre-alert for you, and then you could get going then, couldn't you?
Fine, yeah.
There you go. And I'll say 7 minutes to Russell's Hall.
Immediately, the second dose of antibiotics is in, the crew prepares to leave, while Tom calls ahead to pre-alert the hospital staff.
Hello there, it's Tom, one of the critical care paramedics. Can I pass you an alert, please? A 10-year-old boy. He's had a 2-day history of being generally unwell, nausea, vomiting, not his normal self, very pale, and got a clear blotched rash along his body. They're going to be 7 minutes to yourselves. Obviously, we've got a very high suspicion that he's got meningitis.
For all ambulance crew, dealing with a critically ill child is the most stressful situation they have to face. Thanks to Tom's training and experience, Harry has the best chance of recovery.
What that child needs is a good hospital quickly. The fact that he's got a very typical septicemic rash over his body with the history of him being unwell and deteriorating throughout the day and looking very poorly, those factors mean he needs antibiotics and he needs a hospital very quickly, and that's all we really did. It's a very rare circumstance you go to a child presenting with those symptoms. What I was very conscious of was not delaying on scene, so that's why I passed the details and let the crew, deliver that care ongoing. They're doing a great job. So, I just might pop and see how they go on.
The critical care team in the West Midlands operates 24/7, 365 days a year. Dr. Katie White and critical care paramedic Ian Locke are on standby, waiting for the next emergency as the all-night trauma response unit.
I think you get used to it.
You do get used to it. I think it gets harder as you get a bit older, I think.
Lockie would know better than me.
In the early hours of the morning, a call comes through to ambulance control. A car has been involved in a high-speed collision. A man is trapped inside with life-threatening injuries. Critical care backup is required.
We've been called to a road traffic collision. We've been asked to attend by a crew in attendance. to a patient who has crushed their car into a concrete wall.
From spinal paralysis to life-threatening internal bleeding, the impact of high-speed collisions on the human body can be devastating.
They are just pulling down the Crescent Road towards the scene now.
Dr. Katie and Ian know they're going to have to get there fast if they're going to save a life.
5098, all you received.
Eyewitnesses report the car was seen travelling at a high speed down the dual carriageway when it hit the roundabout.
We haven't got many reports of exactly what the injuries are yet, but if the crew are requesting us, then it's likely that they found something that they've got concerns about.
21 minutes after receiving the call, they are at the scene. The police have had to close the road, and firefighters are hard at work trying to free the injured passenger. Dr. Katie is a consultant anaesthetist. She spends half her time in a hospital and half on the road, responding to life-threatening emergencies.
This vehicle has been seen driving at really high speed down here and has basically just gone head first straight into this entire concrete structure.
To get her up to speed on what's happened, Katie is briefed by the paramedic operations manager who is managing the scene.
The driver is out walking around absolutely fine. The front seat passenger, when the crew rocked up, had quite a substantial laceration and head injury. Okay. Still trying to assess for other injuries, just trying to get the pain under control. Okay. It's so distracting for him at the minute. They're just going for a roof removal to bring him out that way.
Fantastic.
With the injured man still trapped inside the badly wrecked car, a member of the fire brigade is using the jaws of life, a hydraulic saw, to cut the roof away, while another protects him with a blanket as the blade passes inches from his head.
Head injury. Drowned now.
The man is conscious, but he was thrown around the car when it smashed into the concrete wall and may well have sustained serious internal injuries.
So I believe this gentleman has come from down this road, which is quite a fast dual carriageway, hit this concrete bollard. He's actually moved the concrete bollard, shunted it backwards, and interestingly, what we've just seen is that he's actually managed to bend the metal railing behind, and there's a significant drop the other side, so I think he's quite lucky that that concrete bollard's there.
Having examined the crash site for further clues as to how sick her patient might be, Katie wants to assess the driver who managed to walk free of the crash.
I've obviously seen the crash he's been involved in. He's all right. They're just going to get him out. Shall we get you somewhere where I can have a look at you?
Yeah, if not mine.
Yeah, I think I agree with that. Come on, let's go. Let's go down towards the ambulance, and I'll just find somewhere to see you.
Satisfied the driver is fine, Katie heads back to the crash site, where with the roof now off the car, Ian is finally able to examine the passenger. 22-year-old restaurant manager Sahil has been fitted with a cervical collar to protect him from aggravating any possible spinal injury. He's also complaining of severe pain in his left arm.
Do you want to take one side and I'll take the other? Get under this.
Sahil's legs are unharmed, so it will be less painful on his other injuries if he can stand on his own feet and be helped out of the wreckage.
So what we're going to get you to do is to stand up, all right? Turn very gently, we'll support you as you're doing it, and put your bottom kind of in the middle of the stretcher, okay? And then what we'll do is we'll get you to lie down, okay? So you keep your neck nice and still. Where's it hurting? On your arm? Okay, so not touch that arm. Okay, you support that arm and then come up towards me, okay? It's just too sore. Okay, all right. Do you think if somebody was behind you helping you just get up and out of the seat, that might help? Okay, all right. If it's too much, we'll get some more pain relief for you, okay? Okay, do you want me to support your arm? You can't.
If it's a no-go, don't worry, mate. No? Okay.
Shall we
go back to plan B then? We'll
Yeah.
go on the back.
Yeah.
Okay, Rich, longboarding down the back.
Sahil's arm is too painful for him to be helped to stand, so Katie and Ian will have to resort to plan B.
Have you got some morphine to draw up? Has he had any? Or has your crewmate drawn any? I think so. I think he's going to need it no matter what, isn't he?
With Ian in charge, the fire brigade start to slide a spinal board behind Sahil before carefully levering him out. Once he's flat, he can be lifted onto the stretcher.
We're just going to take him in the warm. Thank you. Lovely. There you go. No worries. How are you doing? All right? How old are you? 22. 22, okay. My name's Katie, I'm one of the doctors. All right. What's hurting at the moment? Sorry?
Just his arm.
So I think it's that arm.
Yeah.
So the options are, do you want to hold on to that?
Yeah.
I'm just going to cut your clothes, lovely. So we'll get some pain relief in.
Yeah.
Shall we splint it?
Free from the wreckage, Katie urgently needs to examine Sahil. Being thrown around the car, he could have broken a rib and punctured a lung or shattered a bone in his pelvis.
Take a couple of nice deep breaths.
From us, it was nice.
And that feels all right. Okay, lovely. Injuries top to toe. He's got a head injury, no obvious chest, abdo or pelvis injuries. He's got an obviously fractured left humerus with no neurovascular compromise.
Sahil is lucky. Despite the seriousness of the crash, he's escaped with a broken arm and a cut to the head.
He's had some IV morphine, an IV paracetamol and a splint to his left arm. Crew ETA to Sandwell will be 10:10 minutes. Received?
Roger, Katie, yeah, that's all copied. Thanks so much. I'll get that past you now.
Thank you.
Katie and Ian leave Sahil with the paramedic crew, who'll transport him to hospital while they prepare for the next Trauma Code Red.
Moves that concrete barrier, you'd think lucky. That patient needs to go to a hospital department where he's going to get a CT scan to have a look to just make sure that there aren't any other injuries that we can't see. We didn't feel he needed to go to the major trauma centre or that he needed us to go with him because I don't think as a critical care team we were going to add anything more to his care en route. He has had some pain relief. We've splintered his arm and now he just needs to go and have that thorough check over and then he's clearly going to need a surgery on that arm.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC. That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road, and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a teenager is bleeding to death from a stab wound.
Okay, put a direct on there then.
Don't fight, don't fight.
I know it's scary.
An accident with an angle grinder,
Is it pretty bad? Okay.
He hasn't seen it.
Okay. All right, bud. All right, bud.
an elderly man with a serious head trauma,
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
and a woman has a life-threatening seizure.
Emily, we're going to look after you, okay?
Ambulance service, patient breathing.
He's come off his push bike, he's unconscious, he's breathing, all his teeth are gone and everything. He's in a bad way, his face is hit the road.
And does he seem to be taking regular breaths?
He's breathing very fast.
Is the patient in the road?
He is in the road, yes.
How old do you think he is?
I'd say he's in his 60s. Not tall his teeth, everything.
We've got an ambulance en route, okay, so just keep your eye out for the ambulance.
I will do, yeah.
A local ambulance has already been dispatched to the scene of the accident, but there's a high chance the man has suffered paralysis or brain damage, and his life may be at risk, so critical care backup is needed.
It's come through with an unconscious male in his 60s that's come off a motorbike.
60, that's obviously, thanks very much. I think it'll be about 8 minutes of it.
Critical care paramedics Will Meadows and Colin Apps deal with life-threatening emergencies on a daily basis. Their advanced trauma training gives the most gravely ill the best chance of survival.
Yeah, the information's come through that he's unconscious. That would suggest that he may well have serious injuries, including injuries to his head.
10 minutes after receiving the emergency call, they are on scene. The local paramedics have taken the injured man into their ambulance.
Sorry, guys. My name's Will, one of the critical care paramedics.
I'm Joe.
Paramedic Joe quickly briefs Will on the details of the accident so he can begin his assessment.
He's been travelling on his motorbike, no helmet. Push bike, sorry. Yeah, apparently the front wheel has locked up.
Yeah.
He's gone over the handlebars and full impact on the front of his face.
Okay.
73-year-old Fred, a retired crane driver, was riding back home after visiting his 99-year-old mother when the accident happened.
Bystanders state that he didn't move to start with, so we're querying a period of unconsciousness with him. On our arrival, he's sat up, he's talking, he's fully orientated, he knew where he was, but he couldn't recall the incident of what had happened.
Okay.
Fred's injuries are so extensive, he needs urgent hospital treatment and a brain scan.
We've got a good 2-inch laceration above his right eyebrow. Initially, they said that he wasn't moving.
At the very least, he has concussion, but the memory loss and blackout could be the sign of a much more serious brain injury. It's Friday night, and Dr. Adam Lowe, a consultant anaesthetist at Birmingham's Queen Elizabeth Hospital, is getting ready to start his shift for the critical care team. Tonight, he's paired with full-time critical care paramedic Rob Davies.
It's very hard to predict on any day of the week, but Friday night, people are out and about. Social nights, there'll be more people in the city centre. We may well be busy in and around Birmingham. So yeah, we just get our checklists done, make sure we've got all our kit ready. Hopefully a nice, gentle evening.
12 minutes later, an emergency call comes through to the base.
Hi, thank you. Good evening. Take you on the job, please. It's going to be a 21-year-old male with a stab wound. The stab wound is 2 inches long on his upper back, query with a knife. It also says on the notes, query offender is outside. There's nothing to suggest police on seeing that.
Last year in the West Midlands, there were nearly 5,000 violent knife crimes. Reducing the number of deaths is one of the critical care team's main objectives.
Whiskey 55, thank you. I'm sure the sector told you as well. Crew is en route. We believe these offenders are outside the property and the patient is inside the property. Details are being passed to police at the moment. No, thank you. Just to confirm, these police are not yet in attendance, so we believe the offenders to be outside of.
Hi Nate, that's received. We're about 2 minutes out, so is there an RVB point over?
With the attackers believed to be nearby, the trauma desk instructs Adam and Rob not to go directly to the house, but wait for police protection.
The 2 people are outside who they think have done it, so they're advising us not to go directly to the house. It's that balance, really, isn't it? Because if it's still an aggressive scene or not secure, we don't want either ourselves or other members of the ambulance service getting injured.
5-5, thank you. Police have just pulled up our location. Just stand by you and update.
It's 7:38 p.m. Police and ambulance crew arrive at the address, so Adam and Rob get the go-ahead to enter the property, while our camera operator is told to wait outside.
Right.
Oh, all right.
Are you guys on your own?
Yeah.
You are going to need to go to hospital. Let me just see your front, make sure you haven't got any injuries here.
The man is in shock and distressed with a stab wound to his back. It's unclear to Adam and Rob whether or not he knew his attacker.
OK, well, lie down onto your side then. Lie down onto your side.
This on his left side of his back. Lee, we're just going to lift and go around the corner then, yeah? Happy?
But he's lucky. After assessment by the critical care team, it's decided whilst it's a nasty cut, it's not life-threatening.
They're not nice incidents to go to, but we go to Stabbings fairly regularly, so it's not a surprise that we're being tasked to a stabbing. Unfortunately, it's one of those things, and living and working in the urban environment, stabbings are fairly common and are quite a significant workload for major trauma centres as well.
In the West Midlands, critical care paramedics deal with around 30 stabbing incidents a week.
All right, mate.
And they don't have long to wait for the next one.
We've reached the ambulance. Is the patient conscious and breathing?
Somebody stabbed him on the neck.
Okay. Do you know if he's breathing?
He's breathing at the moment, yes. He needs the ambulance quick as possible.
What?
A lot of blood coming out.
Is the blood spurting out?
Yeah.
It is, my love, okay.
Oh, my God.
Just keep pressing on his neck, my love. We're coming as quick as we can.
Oh, God. I've never seen anything like this. It's getting worse.
Just keep the pressure on that bleed, love. You're doing all you can.
We're on the way to someone who's been stabbed in the neck, and it's spurting, and there aren't any crews there yet, but they're going to let us know when someone gets there.
The second stabbing of the shift sounds very serious. Spurting blood may mean a major artery has been cut. Adam and Rob need to get there fast, as there's a danger the victim could bleed out and die.
You're clear on my side. They are stopping. Yeah, still stopped.
Police and the nearest ambulance have also been dispatched to the scene. Adam and Rob are just 5 minutes away, but with a serious stab wound, every second counts.
Okay, thank you. Just to keep you updated, we're going to keep having extra calls on this. I think people are panicking a lot on the scene. The doctor's going on and saying he's still bleeding through towels that are being applied. There's a lot of blood on the floor, and patients are collapsed to the floor.
Yeah, that's great. We're 1 minute out.
A stab wound to the neck could have severed airways as well as arteries. As trauma specialists, it's one of the most challenging situations Adam and Rob can be faced with.
Hi, guys.
I'm Adam. I'm the doctor on Meadows. Just behind you. You okay? Okay, don't fight. Don't fight.
Adam immediately takes control of the scene, locating and assessing the size and severity of the neck wound.
Can you hear us? Okay.
Right. So quite a lot.
What's wrong with your breathing?
Can we get the trolley?
Okay, guys.
We'll have the trolley out.
He's bleeding heavily and struggling to breathe.
Okay. Big. Adam, can you see down there?
The victim is just 16 years old.
Ambulance services the patient breathing.
In 2012, the West Midlands Critical Care Team and Midlands Air Ambulance joined together to create a specialist trauma response unit.
We've got more experience in dealing with patients who are critically ill or injured.
Let's do a few little checks on you, okay? See how you're doing.
38 doctors and 34 critical care paramedics bring hospital-level care to those most in need.
What we provide is to bring an advanced care team to the patient at the roadside.
I'm just going to have a little look at your foot, okay?
Nice deep breath.
Well done.
By focusing on only the most serious emergencies, their enhanced skills and training often make the difference between life and death.
I think they've proved that with a good trauma network nationally, that you're 60% more likely to survive a trauma.
It's very intense at times and demanding, but thoroughly rewarding. I love my job.
Ambulance services the patient breathing.
Yeah, he's had his hand in a steel saw.
A steel saw?
Yeah, it's gone straight through. Yeah, I don't want to describe it too much.
How far through his hand has the saw gone?
Dan, you need to move your hand, please, because I need to describe it too. I need to put your hand over your face. Hold on. Oh, very, 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 very bad.
We're getting someone to him as soon as we can. Just keep the pressure on the wound, directly on the wound.
An accident with a power tool can inflict life-altering injuries. An ambulance has been called, but they've requested specialist trauma backup, and critical care paramedic Tom Waters is now en route.
Looks like I'm going to be first on scene, and it's someone, they just said he's cut through his hand with an angle grinder. DIY gone wrong. The benefit that I think my team and myself can go to is we can hopefully make that assessment to really identify what hospital is best for that patient.
10 minutes later, Tom is on scene. The local ambulance crew are already there.
Hello? Hi, you're right. So what's happened?
He was cutting the door frame there and went straight through his hand.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
Yeah. He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you at all?
No, I can go grab it.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else? No. No, so it's just your hand? Yeah. Okay. Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case.
Daniel's in excruciating pain and can't bear to look at the damage he's done.
Let's have a look. All right. Are you all right to come round here and cut his sleeve off? Yeah. I've got some scissors on me, if you want. Yeah. Some quick look. Okay. I know, sorry, buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay, all right, bud. All right, bud.
Did he get himself off the floor and self-mobilised into the back here?
Well, no, we took the stretcher out to him, we cleared his C-spine, managed to stand him up and he stood onto the stretcher.
In Walsall, critical care paramedics Will Meadows and Colin Apps have been called to the scene of a serious head trauma.
He's got a full laceration to the top of his lip, complete laceration on his tongue as well, so it's kind of lizard tongue at the front.
Righto.
3 teeth have come out and also laceration to the bottom lip where it's hanging.
Okay.
73-year-old Fred was travelling at speed on his bicycle when he was thrown headfirst onto the road, landing on his face. He blacked out and is now dazed but conscious.
Have we found the teeth, or are they...?
Yeah. We've got 3 of them there,
Okay, so there's 3 missing and you found them all?
Yeah,
okay.
The ones at the back look quite broken as well. There's nothing there I can see that's gone through the pallet at the top.
Mind just opening your mouth there, sir?
Stick your tongue out again, Fred, for me.
Will checks Fred's mouth to be sure there is no obstruction to his airway or damage to the roof of his mouth.
How are you breathing? Is it okay?
Yes.
Yeah?
Yeah.
Okay. Are you in much pain at all?
No, fine. Just a little bit of bruise there.
Yeah, try not to touch your face there, sir, okay? Because we don't want to contaminate that, but...
Yeah.
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
Yeah.
Yeah. Okay.
Will is most worried about Fred's unseen injuries. His head took the full force of the impact. Head traumas are very unpredictable, and there is a risk he may have damaged blood vessels that could turn into a more serious bleed on the brain.
I don't know what happened, actually.
No, I don't think you're going to have the answers either, Fred. Accidents happen really quick, don't they?
Are you on any blood thinners at all?
No.
No?
No medication, no medical history at all.
medication.
Is it still bleeding inside your mouth?
Yeah, try not to touch it though, Fred.
Yeah? Dr. You know that bit between the top lip and your nose? That's split vertically.
Will calls into the trauma desk to alert them that Fred is likely to need reconstructive surgery on his face.
He's got split lips. He's had 3 teeth knocked out. They're all accounted for. And his tongue's been split as well, sort of in the middle, and quite aptly described as lizard tongue. Got a pulse rate of 98, SATs of 96%, T15, and a rest rate of 80. C-spine is clear.
Part of Will and Colin's expertise is to ensure Fred is sent to the appropriate trauma centre that can treat all of his injuries.
Okay, well, I think he's probably going to be needing some max fax specialist.
Fred, what we're trying to figure out is where we're going to take you, where's best to get your face repaired, all right? We're just going to figure that out at the minute, OK?
The Queen Elizabeth Major Trauma Centre in Birmingham has specialist maxillofacial surgeons who can assess and treat Fred's head wounds.
Not surprised.
That lip damage, that filtering damage, that's all from the front teeth, isn't it? Where he's pretty much kissed the floor, hasn't he? So.
You're a tough bloke, Fred, aren't you?
Oh, he sure was.
Fred, I'm going to ask you again, sweetheart, do you want any pain relief?
Yeah, just a bit of painful here.
Do you want pain relief for you?
No.
No?
No, it's all right.
Fair enough.
Try not to keep dabbing it, baby.
Amazingly, Fred seems to be untroubled by his injuries. He wasn't wearing a helmet. If he had been, it may have deflected some of the force of the blow and given him more protection from serious long-term brain injury.
you're getting blood into your mouth, just let it dribble into there. Try not to force the spit, just let it dribble out.
As it stands, he will need a brain scan to rule out any potentially fatal clots or bruising.
How fast do you normally cycle there, Fred?
Oh, no.
It's not got a battery in it, has it, your bike?
No. Just an ordinary racer.
A racer?
Yeah.
Yeah, on his own.
Yeah.
So, yeah.
40 mile an hour then. Head down.
There is still... Trouble Desk is going to give them a heads up, so you can be seen sooner rather than later. And if they can't manage Fred, then they'll get him transferred to the QE where you can go. All right.
Lovely. We'll get out of your way.
I don't know what happened.
Take care. Have a nice day.
All right, Fred, you mind how you go, OK? Next time, wear a helmet.
Yeah, I don't know what happened.
All right, guys, thanks very much. Cheers.
It's a 6-minute journey to hospital. Happy that Fred is stable, Colin and Will leave him in the care of the paramedics, freeing them up for their next emergency call.
Yeah, they seem to be...
Stoic.
Yeah. Very good pain threshold. I would have been crying.
Ambulance service, is the patient breathing?
She's having a fit.
Has she been diagnosed with epilepsy?
I don't know, I'm not sure, sorry.
Okay.
She's fitting really badly.
6-2, we're shown about 5 minutes away. It's reports of a 39-year-old female who's having a seizure in the Merry Hill shopping centre. She's been having headaches, and now today she's gone on to have a fit.
A woman is in the throes of a potentially life-threatening seizure. The critical care team are urgently needed, and critical care paramedics Mike Andrews and Pete Edwards are en route.
Surgeon advised that patient is actively fitting.
That's all received, any patient.
Seizures are caused by surges of electricity in the brain and are an indication of epilepsy, a neurological disorder that kills 1,000 Britons every year.
Oh, there you go, visual. I'll get the red bag. Do you mind grabbing the drugs?
In the shopping centre, a building society clerk has suddenly collapsed at work and started fitting uncontrollably. Her shocked colleagues called 999. An ambulance crew is already on scene.
Hello, how are you doing? All right. How's it going? I'm Pete. I'm one of the paramedics. This is Mike.
39-year-old Emily is lying unconscious. The ambulance paramedic who has been looking after her updates Pete on her condition.
She was fitting for about 15 minutes before we got here.
Yeah, okay.
She's fitted for 2 minutes 54 while we've been here.
Yeah.
We don't know anything else.
Okay. No history of head injury today or anything like that. So we just got migraines recently, had a seizure today. Just today. Okay, all right.
Can you squeeze my hand, sweet? Can you squeeze my hand for me?
As part of his assessment, Pete needs to know if Emily's ever been symptomatic before.
So she is an epileptic, is that what we're saying?
When she was little, she did used to have it, but not recently.
Right, okay, so she hasn't had a seizure for a while, but she has had them in the past.
Probably about this time last year. This is the last one.
Okay.
People's jaws often clamp shut during seizures, which restricts the airways. If starved of oxygen, Emily could go into cardiac arrest. So Pete needs to administer diazepam, a muscle relaxant, to stop her convulsing.
Should we put a bandage on so we don't lose the IV access? Are you able to, is that all right? I'm just thinking that if she starts fitting again, we might get pulled out, mightn't it?
Worried that Emily may start thrashing around when she fits, Pete needs to be sure the IV line is securely attached.
I think now we've got IV access. If she starts fitting again, we'll go to diazepam, yeah? Is that all right? Is that what you're thinking? Yeah, yeah. And BM and everything's all right. I think the best thing, we'll get a stretcher.
Yeah.
Get her onto the vehicle. Yeah, okay.
Pete wants to get Emily to hospital, but she takes a turn for the worse.
Is that wound or is that dressing? What's that there?
In Birmingham, trauma doctor Adam and critical care paramedic Rob are trying to save the life of a boy who's been stabbed in the street.
Can you see? Here.
Okay, so we've got one behind me here.
Yeah.
Is there anything at the front of the neck?
The 16-year-old has a deep wound to his neck and it's spurting blood.
OK, put a direct on there then.
He's already lost about a litre of blood. The human body contains 5. Adam knows he can't afford to lose much more before he passes out and goes into cardiac arrest.
Right, mate, have a look.
What's gonna happen now? Listen, what's gonna happen? Don't worry about them. Look at me. What's gonna happen? I'm gonna get you onto an ambulance, okay? Let me just see if there's any blood in your mouth. Open your mouth wide. Good lad. Okay.
Pressure from his wound is causing the boy to panic and restricting his breathing.
Just calm your breathing. You're doing absolutely fine. I know it might feel hard where you've been injured. Okay, it's away from your voice box. I know it's scary, okay, but you're doing fine. I'm pushing on the side of your neck.
They need to get him to hospital for emergency surgery to repair the blood vessels in his neck, but moving him risks tearing the wound and sudden catastrophic blood loss.
Not tight. Okay. Right. Listen, have you got phlegm at the back? Just spit it out, mate.
Just spit it on the floor, go on.
Adam needs to keep the boy calm while maintaining a constant life-saving pressure on his neck to stop the bleeding.
Do you feel able to stand, mate?
Yeah.
Okay, right.
Good lad. Yeah, go on.
I'm not going to let go because I need to put that pressure on, okay? Hold on, guys, hold on. I need to keep the pressure on.
Can you get around, mate? Are you in? So, bump there, that's it. Lay down on the bed.
Okay.
Once on the stretcher, it's now a race against time to get him to hospital.
Hi, mate, you okay? Can we have our bag on the back? Yeah. My hands are going to be a bit tied up just to keep that pressure on, so let's get some straps on. How are you doing? All right, well done. Okay. I need to keep to the QE. Yeah, I need to keep my hands on to stop the bleeding, okay? Because you have bled a reasonable amount. Any medical history I need to know about? Asthmatic? Sickle cell? No? Are you allergic to anything? Right. Okay.
Leave a little bit of room for me. That's it. Well done. Good, so a bit brighter in here.
On the ambulance, Adam and Rob can now fully assess the damage the knife has done.
Hi, mate. You're right.
He's bled a fair bit of volume and he's still bleeding past my hand, so I need to get a grip on where that's coming from. Tacky 130, active from the back. It's not anywhere major vascular, but it is actively bleeding. Can I have that Celox so I can see where that's coming from now?
Hold on, Adam.
Using a gauze coated with a blood-clotting agent, Adam manages to stabilise the wound as much as possible to prepare for the journey.
Nice and steady.
All right, buddy. We're going to sort you out. We're going to take you to the QE. Good work.
You're doing great, mate. You're doing great. Have you got pain anywhere else? No. Okay.
12 minutes after they arrived on scene, Adam and Rob are en route to hospital.
Okay. Rob, do you want to carry on looking at access for me?
Yeah. Give us that arm.
The boy is in such a critical condition, they both need to travel with him, continuing emergency care throughout the 6-mile journey.
I'm going to do the TXA. Yeah. You can do a set of obs.
Arriving at hospital 11 minutes later, Adam delivers his still critically ill patient to the waiting emergency staff.
That's one of the things we are there for. We will just bring some advanced decision-making in terms of which hospital we're going to. We won't go to the nearest hospital. We will travel a little bit further with an unstable patient to get them to the right major trauma centre.
Let's get the stretcher, let's get something to get her out and get that sorted, all right?
In Dudley, critical care paramedic Pete Edwards is fighting to control the seizures threatening 39-year-old Building Society clerk Emily's life.
Emily, we're going to look after you, OK? Let's get a BM done, make sure her blood sugars aren't low. We've got her on oxygen, OK? If she starts really fitting again and it's prolonged, we'll give her some diazomols, and obviously we'll just have to then do a bit of airway maintenance in case she goes on. And we'll just pop the SATs probe back on, just keep her eye on her SAT.
Whether or not we have the condition, 1 in 20 of us will suffer a one-off epileptic seizure at some point, and they can be fatal.
rush. Just have a look at that mine, make sure I've drawn up the right thing. It's diazomals and it's in date. Okay. Yeah, 10 milligrams in 2 mil. All right.
9 minutes after the last one with a sedative anti-seizure medication on board, Emily's condition seems to be improving.
Pop her onto a side just for, like, into the recovery position. Yeah.
She is more alert, and her convulsions appear to have subsided.
Yeah, super. Yeah, no, that's fine, that's fine.
But Pete's critical care training makes him ever watchful.
And even in the most severe cases, despite us giving anti-seizure medication, the patient continues to fit, and this can become time-critical emergency.
With a sedation, there's a risk her body could struggle to breathe.
If we don't manage the airway and the brain is starved of oxygen, there is brain damage, brain death, and ultimately cardiac arrest.
The priority now, get Emily to hospital.
Emily, my love, can you hear me okay? Listen, we're going to get you up the hospital and get the doctor to look at you. We just got to get you onto the stretcher now. I'm just going to pop the oxygen off for now. I'm going to sit you up, nice and steady, just bend in the middle. Okay. Right, Emily, lean back against me and just have a moment, because you've been lying down, all right? You all right? Do you know where you are? No? It's a bit strange. We're going to help you. All we've got to do is get you onto him and get you nice and comfy. Okay, so we'll go on through. We'll have a little rock. So, 1, 2, and 3. Up we go onto our feet. Lovely. Super. Emily, swing your legs up. Let's get you comfy. That's it.
The ambulance will take Emily to the nearest emergency department.
Thankfully, on this occasion, she appears to have made a quite rapid recovery. Some patients will just have one seizure, make a recovery, and they're absolutely fine. But we do go to these patients who recover, and then sometimes it might be minutes later or even seconds later, they'll have further seizures, and this can be quite complicated. And those sort of patients, we get them to hospital where they can be assessed further sometimes, just to make sure there isn't anything more untoward going on somewhere.
How bad's the pain out of 10?
Okay. In Stourbridge, critical care paramedic Tom Waters is trying to assess the damage to Daniel's hand after he sliced into it with an angle grinder.
Okay, all right, bud. All right, bud. Turn your arm round. All right. You feel me touching your hair? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
Wiggle that thumb for me.
Can't.
Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. Don't make you obviously know where it is.
Lucky for Daniel, the blade stops short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands. Yeah. And it's, yeah, so I think it's just more soft tissue.
Yeah.
We're going to cover it.
Yep.
And then I think we'll...
If we just take a picture. So
yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Yeah, nice and still,
mate. All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
I'm going to bandage that up. Yeah, it's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. It won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed.
Yeah.
And it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
That's all right, mate. There you go. Just take your time, nice and slow. We're in no rush. Feel right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an X-ray, and then it will be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer, we obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully he'll have a really quick recovery.
One of the trauma team's key areas of expertise is paediatric emergency care. Being called to a critically ill child is every paramedic's worst nightmare, so they need to be able to rely on a high level of skills and training.
Ambulance service, is the patient breathing?
Yes, he is.
Are they conscious?
Yeah, yes, he is.
And what's wrong with the patient?
He's just gone completely down the stairs.
He fell down the stairs?
Yeah, he's two.
Top to bottom, was it?
Literally, yes. I think his wrist might be a bit broken.
Oh. And did he bang his head, or has he landed on his
I'm
feet?
not... I don't know how. He landed kind of upside down at the bottom.
Six two. I've got you that it's a 2-year-old that's fallen down the stairs. Is that correct, Emma?
That's correct, mate. Yeah, top to bottom of the stairs, there's fallen 3 metres or more. Child's had a head injury. They are conscious, but they've clearly got a fracture wrist as well.
Roger, that's all received. Thanks, Mike.
In Albury, critical care paramedic Faye Pollock is en route to a code red emergency. A 2-year-old child has fallen 3 metres downstairs, landing on his head.
Just confirming that he has fallen top to bottom of the stairs. He's got a head injury and a wrist injury.
An ambulance has been called, but with the potential for life-threatening injuries, the trauma team's enhanced skills are also required.
Obviously, because it's a child and they have their whole lives ahead of them. The last thing they want to do is be fighting for their life or be disabled in any way because of an accident.
3 minutes later, Faye is on scene, ready to be briefed by the ambulance crew.
This is young Josh, 2 years of age. Mum said he's got this big habit at the moment of doing Superman down the stairs. But she's in here and she's heard thump, 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 thump.
Yeah.
I haven't touched him, I haven't done anything. We literally just got here, found out the history, that's it.
OK, I'll have a chat to Mum initially. Is he acting as normal now? He seems quiet.
Yeah, he's very hyper, Josh is. He's constantly on the go.
Mum Rachel confirms there has been a worrying change in Josh's behaviour. The worst-case scenario is that Josh has fractured his skull in the fall and has a potentially fatal bleed on his brain.
This is almost as if he's either covering his eyes or his arm's hurting. I'm not sure, but this is unusual for him to put his arm across.
No, we can do that with strangers.
So that might be a comfort thing, the fact that we're OK.
Critically ill or injured children can appear to be OK, but then suddenly go downhill.
So the little things like that, only mums know, but it says a lot to us in that
definitely.
He's not photophobic.
Josh, can we put something onto your thumb?
No.
Josh needs to go to hospital to be scanned. First, though, Faye needs to take his blood pressure and heart rate, but Josh is too distressed.
He hasn't been sick, has he? He's not.
No sickness.
No.
If he's gone down the stairs the way he has, you're not going to come down without the mark, are you? No, that's couple of stitches, because I've not really been able to get too close to be able to really get my hands on, and the only thing I'm doing when I'm getting near him is distress.
Makes him more upset.
At the moment,
He has also been guarding his left arm in a way that suggests he might have broken it in the fall.
I tell you what, let's see if we can try a little trick. Can I have Mickey a second? Is that Mickey? Let me just have Mickey for a second. Let's see. Let's put
Oh, don't you want to give Nick your
That's a good sign that his arms are all right. Yeah. You fell for the trick.
Encouraged by Josh's reaction, Faye tries again to attach the monitoring equipment.
Do you want to which finger? Which finger?
Should we do it on this one?
Do you want to try?
Should we try it on your foot? Yeah, come on.
But he's not falling for it.
Mommy, do it. Mommy, do it.
He's certainly a good colour in his lips, good colouring in his face. The fact that he's able to understand and say no are all the signs that I think he's probably just shocked himself. Yeah, distressed himself.
To help soothe Josh, Faye wants to administer some paracetamol.
It'll make you feel better, sweetheart. Good boy. Come on, Josh. Okay. Oh, that's it. Good boy. Well done, Mum. You've done that before.
Paramedic Nikki has a trick up her sleeve to try and take Josh's mind off his troubles.
You're going to catch him.
Distracted by the bubbles, the paramedics manage to attach the oxygen saturation and heart rate monitor to his toes.
Yay, well done, Josh.
Should we see if we can get him over there? You can catch him. Can you reach over that way? Oh, well done.
That has worked a treat. Well done, you.
Quick thing.
I like footballs. Yes, it's about amusement. Doesn't matter about the patients. Apparently the wounds on his legs are from previous Superman impressions, yeah?
It must hurt, but it doesn't stop him.
It's excitement though, Dad. It's the excitement of going head first down the stairs.
Josh looks to be making good progress, but Faye still wants him to go to hospital to be checked over by the emergency doctors.
Mum, is there anything that you need?
No.
Immediately.
I've already done it.
Oh, yeah. Oh, God. Wow. That is one prepared mother. Bye-bye.
Thank you.
You take care, Mum. Well done for keeping you cool.
She leaves him in the care of the ambulance crew for the 6-mile journey to Birmingham City Hospital.
So you're never quite sure what injuries they may have. And as you saw, he's so scared and he's so anxious, the fact that he's got 3 strange people in the room. He immediately curled up into a ball on Grandma's lap. So there was no way that we were going to be able to assess him for his injuries properly there until the paramedic got an absolute beauty with those bubbles.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC. That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
Ready, steady, roll.
Tonight, in a rush hour collision, a motorcyclist is thrown headfirst from his bike.
Mate, can you hear us? He hasn't got a radial pulse. Is he breathing?
A builder's leg is sliced open.
That piece of metal has gone through your skin. You can see muscle and fatty tissue.
A man in cardiac arrest.
Anything on that ECG?
And medics' lives are in danger as they treat a patient with suspected coronavirus.
Hi guys, we're not going to come in just yet. We're just going to have a chat to you if that's all right.
Clear guard, breathing filter.
It's Monday morning and the start of shift for Pete Edwards.
I don't know whether I'm a morning person. The first hour or so, I take a little bit to warm up.
He's been working in the ambulance service for 15 years, the last 2 as a highly trained critical care paramedic.
It's just the initial getting up, isn't it? Get a cup of coffee, and that's it. It's all good then. Get the vehicle checked, and then it'll be on to crew welfare, as we call it.
But today, there is no time for any morning cuppa.
Ambulance services, patient breathing.
Let me just go over. Is he breathing? He is breathing.
Is they conscious?
No, he's unconscious. He's bleeding quite badly. His helmet's come off. He's got a severe gash wound at the top of his head.
Was it a car versus a motorbike?
Yeah, car versus motorbike.
We're heading towards a patient that has been reportedly hit by a car. The initial call said the patient was in cardiac arrest, so it obviously sounds quite serious.
An ambulance has already been dispatched, but the biker is thought to be so badly injured that Pete and another critical care team are being sent to give life-saving treatment.
Because of the nature of the job, they've also responded Helimed 03 with a medic on board, and that'll be coming from Cosford.
Helimed 03, a Midlands Air ambulance, is also scrambled. On board is another critical care paramedic and a trauma doctor, qualified to carry out roadside surgery.
6-2 at scene.
Once on scene, Pete is briefed by the ambulance crew.
Hi guys.
Hi.
How are we doing?
Helmet came off in the crash.
Has he been speaking to us?
Not at all. We've been like this since we got it.
Okay.
21-year-old Curtis has been thrown from his motorbike after colliding with a car. In the impact, his helmet came off before his head hit the road.
Okay. He's a bit agitated, isn't he?
Curtis has a severe head wound.
It's quite common when we get this sort of patient. Big head injury, start getting agitated. It's not intentional, he doesn't know what he's doing. He's got a really reduced level of consciousness. He says, you got a radial pulse?
Yeah.
Okay, let's see if he'll tolerate an oxygen mask, all right? Let's pull his stuff out. Yeah, that's it. We'll see if we can get him onto the scoop as best we can. His GCS, his eyes are open.
To try and evaluate him, Pete uses the GCS, or Glasgow Coma Scale.
Mate, can you hear us?
Usual hazard C.
A scoring system that helps describe the level of consciousness. A normal score for speech is 5.
Verbally, he's probably a 2, his knee.
Further indication that Curtis may have a traumatic brain injury.
We want to protect his brain, and by taking over his ventilation and us doing it instead of him, we can protect his brain and stop it swelling, hopefully. That means putting him into an induced coma.
Breathing automatically with a ventilator will allow Curtis's brain time to rest, calming the swelling. But an induced coma is a risky procedure, usually only carried out in hospital.
Are we treating it as life-threatening this time?
I would say it's got the potential for that, yeah.
The critical care team carry drugs and anaesthesia, normally only used in hospital operating theatres and intensive care units.
We start the interventions that they start in hospital, we start them early and get people to hospital in the best shape that we can.
I'm just going to get some midazolam, and then at that point we'll put them onto my ventilator because it's just a bit better for them, if that's OK.
In cardiac arrest cases, these roadside treatments can make the difference between life and death.
Ambulance services, a patient breathing?
He's passed out. I can hardly feel him breathing.
So he's not breathing very often at all?
No.
You at home?
Yeah, I'm the wife. He's sitting in the car. The next door neighbours.
OK, brilliant. Put your neighbour on the phone for me.
Hello?
Are we able to get him out of the car and onto the floor?
We can do, yes.
Do that straight away for me. You need to start doing some basic life support.
Oh my God, I've never done this before.
I can talk you through it, sweetheart. What I need you to do is start pushing down hard and fast, OK? You need to go 2 times a second.
1,
yeah,
2,
that's
1,
it. Keep going at that
2,
speed. Fantastic job.
2, 1, 2.
No, don't worry about pushing too hard, OK? Keep your arms straight and just keep going for me.
1, 2. The ambulance on its way?
Yes, it's already on its way, darling. I've got them coming to you as quickly as I can get them there. They are coming on blue lights, OK?
8080, male cardiac arrest in field zone.
An 80-year-old man is in cardiac arrest. As well as dispatching an ambulance, the code red emergency is passed to critical care paramedic Rob Davies.
Go ahead.
Yeah, basically, for the quick update for you, the patient will take the occasional breath.
In cardiac arrest, the brain stops sending signals to the heart. It stops beating and oxygen ceases to pump around the body. Only 1 in 10 of hospital cardiac arrest patients survive.
What was the call connect time, please?
Yeah, call connect was at 15:52.
Yeah, 15:52 call time. Yeah, roger.
Without CPR, the brain can be irreparably damaged in just 6 minutes.
The call connect time that I asked for is the time that the call comes into the ambulance service, so that'll hopefully give me a fairly accurate time of when the cardiac arrest was identified. So we're about 10 or 12 minutes into that now.
Rob arrives 14 minutes after the call, by which time the ambulance crew are already on scene.
How are we doing, guys? You all right? Yeah, good. How are we doing? Still breathing for himself? Brilliant.
Feeling unwell, 8-year-old Keith asked his wife Monica to drive them home. As they arrived, he collapsed.
Is he prescribed anything?
Yes, but he stopped taking it now.
Right.
He doesn't take any medication. Nothing wrong.
It's all in a quick time frame. He was making some gurgling noises.
Fine.
She's pulled up, gone inside, called for us, neighbour stopped to help.
OK.
So it's all in a quick time frame.
A neighbour gave Keith CPR and got his heart beating again.
He was making some mild respiratory effort during the CPR. 1 shock, return of circulation.
Beautiful. Good work. I'll just go and draw some drugs up, right? So the gentleman's had some bystander basic life support, some chest compressions. On the arrival of the paramedic, he's found his heart to be in a rhythm that he can shock. He's given him a shock through the defibrillator, and now he's got a pulse back. I'm just going to drop a little bit of sedation, just so that we can help with his breathing. Let's have him up and out then.
Although Keith's heart is now beating, there's a danger it could stop again.
And then we'll just place him on there.
Up to 79% of hearts re-arrest before reaching hospital.
We got him up and away.
Critical care paramedics like Rob are specially trained to fight those odds.
Just hold his arm there, chap. I can't reach it. There we go. Right. So, plan is then if somebody can stay in the back with me, what I'd like to do, we can have a little look and just see if we can give him a little bit of sedation and then just get him onto an eye gel.
To ensure sufficient oxygen reaches his lungs, Rob must insert an eye gel tube down Keith's throat so the paramedic can control his breathing.
Yeah, if you can chuck a bit of lube on it. Okay, so just go with him on that. Can you do the ECG?
An ECG, or electrocardiogram, records the electrical activity of the heart.
Just give him a little bit of sedation just so that we can ventilate him a bit better. We might look at a bit more of that. Okay, let's have the rest of these clothes off. Anything on that ECG? All right, chap. Georgie, how long to the QE?
About 15 minutes.
15. Lovely. Smooth, but rapid, lovely.
Keith is seriously ill, but Rob's goal is to get him to the nearest cardiac centre alive.
OK. Still going against that a little bit, is he? We can go.
Dr. Matt Rowley and critical care paramedic Tom Waters are starting their shift just as paramedic Kerry Penn-Ashman is finishing hers.
Remember your PPE, remember to wipe over the cloth.
These medics are used to facing danger, but at the outbreak of the coronavirus pandemic, the level has significantly increased.
Following the corona outbreak, how we approach people and how safe we've got to be has just completely changed.
Coronavirus has huge implications for us as healthcare professionals, and it means that we're having to be more careful about how we protect ourselves. We're having to carry quite a bit of PPE, which is personal protective equipment, stuff that protects us against this particular virus.
Without PPE, patients might unknowingly infect the medics with COVID-19, and the medics might infect their patients with a deadly virus.
Because there's a potential that we're going down to the patient's face, that we're going to do things that might mean that the patient is going to get droplets of sputum, any sort of bodily fluid, into our space. So you have a hood that fits onto your face, that goes over the top of your head, and then you have a little portion there that fits onto these sorts of respirators, and you put that on your face, and that gives you quite a few hours, potentially about 6 hours, of good, clean air.
For most of the critical care team, the need for PPE in the eye of a pandemic is a new experience, but not for paramedic Tom.
Did Tom tell you he was out when the Ebola outbreak happened as well? Went out to volunteer, didn't you? Bit of a hero, aren't you, really?
Ambulance services, the patient breathing? Not very well. Are they awake? No, he's unconscious. How old? He's 60. Is it regular breathing? No, it's not regular breathing. Not, okay. He was just standing at the end of the bar. He just dropped to the floor. He banked his head on the edge of the bar and he went unconscious. We're coming as quickly as we can. Don't be alarmed if they come in wearing face masks, okay? Oh, right, okay. Please don't be worried about that. No problem at all.
A collapsed man with a suspected head trauma can be a Category 1 emergency.
Yeah, okay, that should have come through now.
A local ambulance is almost at scene, and 30 miles away, Tom and Dr. Matt are en route, but want to know if the patient could be a risk to them.
Have we got any symptoms that are suspicious of COVID for this chap before we go anywhere near?
I believe that was affirmative. He's high risk for COVID. He come through as coughing, difficulty breathing.
As the patient has suspected coronavirus symptoms, the medics need to wear their PPE, but it takes several minutes to put on. Precious time that could be used treating him.
With the nature of what's going on at the moment, we need to make sure that we protect ourselves with our personal protective equipment, and we'll make a decision from there.
Tom and Dr. Matt might need to save their patient's life while knowingly risking their own.
If we need to do advanced procedures and interventions, we will do them, but we have to balance that against the personal risk and also the risk of not delaying that patient getting to hospital. I think definitely when we get back, we need to get the hoods and stuff out now.
In Oldbury, critical care paramedic Pete is treating 21-year-old Curtis, who has been thrown headfirst from his motorbike after colliding with a car.
Let's just try and keep him as still as we can, all right?
The impact dislodged his helmet, and he now has a suspected brain injury.
Pop his legs onto there. We'll get him on the stretcher. I think he's a bit hypertensive because I can't feel a radial pulse.
Curtis's condition is so serious that he needs a trauma doctor to put him into a coma to protect his brain. But the air ambulance carrying one is still 8 minutes away.
I think the priority, right, if we can get him on the back of the vehicle and we can do a proper assessment on him, we'll get some access.
Curtis is losing blood from his head, but his weak pulse indicates internal bleeding too.
We'll get full monitoring on him. We'll see what his BP is. I suspect his BP might be low, so it may be that he needs some TXA, all right. Well, if we could get some head blocks on just to keep his head still, all right.
So you've got IV access,
Nice one, all right. Is that the TXA, is it? Yeah.
Pete needs to give Curtis tranexamic acid, or TXA, which helps prevent excessive blood loss.
Let's get full monitoring on him if we can, and let's see what his observations are. Let's cut his trousers off and get that skin to skin. All right.
The doctor on board the air ambulance is now just moments away, but Curtis is deteriorating by the second.
Is he breathing?
Yeah.
His respiratory is very shallow. It's obviously quite poorly. Let's get an airway in him if we can. What we might need is a BVM as well once we've got that. So let's get that eye gel in first.
29 minutes after the 999 call, the Midlands Air Ambulance arrives with critical care paramedic Ryan James and trauma doctor Ben Taylor.
He's collided with that car, or the car's collided with him. It's thrown him off, his helmet's come off in the impact. He's got a big head injury. He's been spontaneously breathing, although he's very shallow. I'm setting up for RSI.
I'll leave you set up, carry
on. Yeah.
I'll assist.
All right, yes, please, yeah. Is that all right?
Sort of drugs out.
Yeah. He's had some TXA due to mechanism. Yeah, I've drawn some ketamine up. There's 160 left there, Ben, because he's had 40 out my 200.
The critical care team use a range of powerful anaesthetics, like ketamine, not carried by ambulance crews. They can also perform procedures normally only done in hospital.
Going to give an anaesthetic just to protect his brain and give him the best possible chance of recovering from his injuries.
Putting Curtis into an induced coma might give his brain precious time to recuperate and encourage any dangerous swelling inside his skull to subside.
So plan to the RSI within the next 5 minutes.
To place Curtis into a coma, he first requires RSI, rapid sequence induction, an advanced critical care respiration procedure that Pete decides is safest to do outside the ambulance.
Because the process is quite risky, we need to have 360-degree access. So if the patient starts to deteriorate for any reason or we're having difficulty with the airway, we've got good access and we're not sort of fighting over each other.
Dr. Ben then prepares to put Curtis into a coma with 2 injections, a sedative and a paralysing agent.
BVM.
Yeah, on.
End-tidal.
End-tidal's on, reading at 3.0.
BP systolic.
The last systolic was 127.
And cycle set.
Cycle set every 3 minutes automatic.
Saturations. Okay, drugs going in now. Okay, fentanyl's in. Ketamine is in.
Okay, everybody ready? Okay, so oxygen mask is coming off. Okay, there's no loose teeth that we've seen. So I've got the blade and I'm going to open his mouth as wide as I can.
We're going to go for the video
So we've got video scope first with a size 4 blade. Okay, we've got a backup of a Mach 4.
Yeah.
Batteries checked, charging.
Okay.
A laryngoscope, a camera with a screen, allows Pete to look into Curtis's airway for obstructions.
I'm going down the right-hand side of his mouth, sweeping the tongue to the left, and I'm going to walk down as I go and looking for landmarks. I've got the epiglottis, but... OK, a bit of suction, please.
Suction.
There's quite a lot of phlegm at the back of his throat.
What should we like?
OK, I've got a grade 1 view there, I can see the cords.
With a clear path, the breathing tube can be inserted into the trachea.
OK, I think through the cords and the black line, we are 22 at the teeth, Ben. OK, we've got misting of the tube. OK, I'm coming out with the blade. Cheers, thanks.
Curtis is now in an induced coma and breathing with the aid of a ventilator. Dr. Ben and the ambulance crew have done all they can.
It's nice and steady, buddy.
The importance of our services, we're bringing some of the emergency department to the patient rather than the patient having to wait to get to the emergency department. He's been anaesthetised a lot faster by us getting a doctor quickly to scene, so we've saved him some time and hopefully improved his outcome that way.
Critical care paramedic Alistair McNeil has just come on shift, and romance is in the air.
It is Valentine's Day today, so whether we'll get any squabbles between couples, you never know.
Paramedics are much more likely to deal with violent crime than lovers' tiffs. Last year, there were over 90,000 in the West Midlands alone, many ending with on-street life-saving trauma treatment.
Ambulance service, hi please.
Father has beaten son with a pole, potentially. The son has a hole in his head and he's bleeding. The son's 37 and the father is age 63.
Is there a lot of blood there, can we ask?
The blood is dripping. Brain matter cannot be seen. However, there is a big hole.
A violent assault likely to result in catastrophic brain injury is an immediate Category 1 emergency.
So we're often addressing Dudley, which is coming through as a serious assault, I believe. Somebody battered with a pole.
With over 14,000 physical assaults a year on emergency workers, critical care paramedics like Alistair are in real and present danger.
There's potentially some suggestion whoever's got this pole and has been battering somebody is still on scene or near to scene. I believe control are liaising with police for finding a standby point for us. 6-2 over.
When you go to the junction where the Tesco is, probably just pull in there.
Yeah, mate, that's all received. I can picture where you mean, Spitchy, mate. It sounds like there is somebody who's carried out potentially a serious assault.
His patient may have potentially fatal brain injuries, requiring urgent trauma care. But for his own safety, before Alistair can approach the scene, the police must declare it safe.
The annoyance is that we could be delaying care here. The police know far more about this than we do.
That went to an ex-colleague of Rem Rosk, who was still trying to ascertain a BP.
Critical care paramedic Tom Waters and trauma doctor Matt Rowley are on their way to a collapsed patient displaying symptoms of coronavirus. And they've just heard that the man's condition has become critical.
So So there's an ambulance crew on scene with a patient who has had a cardiac arrest. They've resuscitated him and managed to get his heart restarted again. Because his heart has been stopped for a period of time, there's been a lack of oxygen going to his brain, so now that his heart has restarted, he's quite agitated and combative, and they're struggling to manage him at the moment. So we're going to try and intercept them on the way to the hospital and see if we can offer anything, potentially giving this man an anaesthetic to stabilise his condition and transfer him onto a hospital.
They've decided to meet the ambulance en route, as it will save time and ensure the patient gets vital treatment as quickly as possible.
We're going to make a rendezvous point for, we're thinking M42 junction 9, crew only just leaving scene, so that looks like it's going to be the best place.
The issue that we've got with this patient is they're quite a long way away, so the plan ideally is going to be for them to load the patient on the ambulance if it's safe and then travel towards us and us meet them on the way to hospital just to try and save delaying any time there.
If we're looking to RSI, it's going to be aerosol generating procedure. So this triggers for high risk PPE, so that's for high risk PPE.
Yeah, well, I mean, we are at the RVP anyway. We'll wait for the crew to get to us.
If the patient's heart stops again, Matt and Tom may have to perform life-saving interventions in the closed confines of an ambulance on a patient suffering a killer virus. If so, they'll need their PPE, but it takes 10 minutes to put on.
So what we might do is just open the door, just chat to them, and then make a decision from there. Hi guys, you're right. We're not going to come in just yet. We're just going to have a chat to you if that's all right. From our understanding, it's a cardiac arrest. You've then shocked him, or
No shock. No shock. CPR. 2 lots of adrenaline.
Okay.
And we got a Ross back.
Yeah.
Went off again. CPR. About 2 minutes, come back across, and maintain his own airway sync.
I honestly think that by the time we've donned, it's going to take us 20 minutes. So I think if you're happy, we just drive, we'll follow behind you. It's not a point of us not wanting to do it, but I think by the time we've done it, we'll be there. Okay.
Perfect, yeah, I'm over that.
This patient has an airway, is a GCS of 15, is bradycardic. So we have 10 minutes.
Tom and Matt decide the best course of action is to follow the ambulance and not delay its journey further.
So the plan currently is to follow the crew into hospital. Should they need any assistance, then we're here, we'll have to pull over and have to get our PPE on. But ultimately the best thing for this champion is to get him to hospital as quick as possible. Pete, just planning ahead, have you spoke to Heartlands? Because obviously if we put this in as a high-risk COVID, it's going to put the hospital into probably a bit of a state of emergency. Have you had a discussion with Heartlands already regarding this?
I haven't, no, but I certainly can do.
Emergency departments will have a protocol that they now follow for patients that will attend with suspected COVID-19. Again, that is probably going to tie up a significant amount of staff. So yeah, it's probably going to need an RSI on arrival. So again, if you do the high-risk COVID thing, that'll be great, and we'll be there in just under 10.
It's cumbersome and time-consuming to put on, but over the next few weeks and months, the NHS will come to rely on supplies of PPE like never before.
Quite rightly, the ambulance crew that had treated him had put their high-risk personal protective equipment on, which involves a suit, boot covers and a respirator, so that they're not breathing any infected air or any infected air droplets around them. For us to do that would probably take around 10 minutes for myself and Tom to both put our PPE on. So that's 10 minutes wasted where the patient needs to be at hospital and at definitive care. So because the patient was relatively stable at this point, we made the decision not to delay things further, but to escort the crew to hospital with us being available should he need any interventions.
The patient is transferred into a COVID-19 ready cardiac unit.
Numbers at the moment, pulse 115, 14191, End tidal 4.2, SATs are 86%, but he's cold.
In Hales Owen, critical care paramedic Rob Davies is en route to hospital with 80-year-old Keith, who is critically ill following a cardiac arrest.
Go 50 to start off with. Does that sound reasonable?
His condition is so serious, Rob phones ahead to discuss his plans for treating Keith.
My plan is to give him some rocuronium just so that I can just better ventilate him.
Rocuronium bromide, or ROC, relaxes the muscles and allows the team to completely control Keith's breathing and optimise the oxygen getting into his body, which is vital after a cardiac arrest.
He's probably 80 kilos, something like that. So 50 seems about reasonable, doesn't it? We got a good end tidal trace.
A correct dosage is crucial.
Essentially, what we're trying to do is buy some time to keep the major organs oxygenated, primarily, you know, the brain, heart and lungs. I'm going to have that out, so some vomit there.
But Keith's condition worsens when he begins to vomit.
Okay.
To prevent him from choking, Rob uses a suction probe to clear Keith's mouth and throat.
Let's just have the... You've got it there, I'll just go down the side. So the end tidal, I think, is blocked now, so you can hear it, yeah.
Vomit blocking his ventilation tube could starve Keith's brain and other vital organs of oxygen.
Just going to get a new end tidal. That's what we're going to do, just going to swap that out. Swap that straight onto there. Okay, so if you vent on that, that one can go on the floor. We've got end tidal back.
Airway cleared, Keith stabilises and now has a chance of survival.
Early bystander CPR and early defibrillation make a massive difference into this patient group. By doing that CPR, we then have a viable heart which to shock. If nothing was done for that gentleman, I think it would, well, no, it would be a very, very different outcome. What I'd like to do is just strip all this off him. Doesn't need these.
52 minutes after the 999 call, the ambulance arrives at hospital, where Keith is handed over to the team in A&E.
Okay, let's go. So he's got pulse back. We tried to sort his airway out. It's quite difficult. He's on a ventilator, and it'll be 24, 48 hours, I think, before they perhaps try and wake him up and see how he is neurologically.
Critical care paramedics undergo 2 years of specialist training for code red emergencies.
Right, we're going to cut this off.
Whether it's resuscitating a person in cardiac arrest or saving someone after a horrific accident.
You're doing a great job. Sit, well done. Nice deep breaths. Nice deep breaths. Keep going.
7062, go ahead.
And a call's just come through that's about to test the trauma skills of critical care paramedic Steve Mason.
Roger. Thanks a lot for that.
Ambulance service, is the patient breathing? Yes.
What's happened?
Had a cut leg, quite a bit of blood loss.
What's it, Brad?
At a basement construction site. He's cut his leg on something down there.
How much blood did he say he's lost?
Fine.
Don't move in. We'll be there as soon as we can.
Accidents on building sites can be extremely challenging for the critical care teams. Dealing with life-threatening injuries in hazardous environments calls for calm under pressure. An ambulance crew is already on scene, but because of the potential severity of the accident, critical care paramedic Steve is also en route.
62, just arriving on scene. Is there any other resource on scene?
The crew are booked to attendance 1406, over.
Soon after the hoarding, take a left.
OK, cheers, buddy. Thank you.
Arriving at the site of a large office block development, Steve is directed down to the basement level.
Roger, made contact. Let him lift up with his good leg.
There
we go. Shift it across onto here.
59-year-old Mark is being looked after by colleagues who bandage the wound with a towel to try and stop the bleeding.
Step back, point it like this.
What, and that's... It's not really sharp, is it? Quite sharp?
It's not even sharp, is it? It's just...
Yeah.
Mark was carrying some pipe when he fell 2 meters onto the end of a scaffolding pole, which has sliced into his calf, leaving a wound at least 2 inches deep.
62, just a brief update. Got 59. Can't get any signal around here, so...
With no signal underground, Steve is unable to contact the regional trauma desk to ask them to alert the hospital that Mark may need urgent surgery. The ambulance crew carry him out to the back of the ambulance, where Steve can properly assess the wound.
So how did you do it?
Trying to take some pipe down, I just lost my footing.
So you must have fallen down, because it's not that sharp, is it? But because, I suppose, with your body weight falling down, probably caused it to go through your car. Was it spurting, do you know, or...?
Well, I didn't do spurting, but it was coming out pretty fast.
Was it?
He's already lost a pint of blood. If the wound is spurting, it means Mark might have cut a major artery.
Just get ready, just in case it starts spurting.
In Dudley, there are reports of a serious assault, a code red emergency.
Sounds like there is somebody who's carried out potentially a serious assault and could well come back to this address, so don't really want to be in somebody's living room when somebody comes back with a weapon.
Critical care paramedic Alistair McNeil is awaiting police protection before he can approach the house.
6 to over.
Paramedic police on scene.
I'll go and have a look if they're happy.
Once given the all clear, police give Alistair a brief assessment of the scene. It's 4:25 p.m.
Hello. Are you all right? Have we got a large hole in the head or not?
2 males in here, yeah. One's got an injury to his mouth, which smacked in the face.
Right.
And the other one's got the injury I can see is on his head here. Bit of a wound, maybe about that.
Fair enough. Well, let's come and have a look at him then. Okay.
Yeah, I'm very sorry.
Right, folks, what's happened to you both?
He's got it, so kick through the head.
Okay.
Push through the floor and into the head, yeah.
Okay. Any weapons used on you?
No.
No? And is it literally just your heads that have been hit? Were you knocked out when this happened? Can you remember? Can't remember. All right.
Harry says he and his son Alan were attacked on their way home from the pub, but no weapons were used.
How much have you had to drink? Can you remember? Or do you know, Harry? How much have you both had today? Few cans. Look at my nose.
A drunken brawl is not usually a code red emergency, but Alistair is concerned by Alan's demeanour.
And while you've been with him, has he been drowsy like this? Because he's a bit sleepy. Was he like that beforehand because of the alcohol, or is this...
He's concerned Alan may have concussion, a type of traumatic brain injury.
I guess we're heading towards... Are we popping him to hospital? Yay, nay? I'd say probably yay, because of the drowsy, yeah. Which comes to you, Alan. Are we popping you down the hospital? You're a little bit drowsy with a little bit of a lump on your head.
I'm all right.
Yeah, the problem, Harry, is he's a bit drowsy, isn't he? While we're talking to you and you're aware, he keeps sort of nodding off to sleep.
Yeah, I'm sound as a fan.
We really are not going to win, are we? I don't think we're quite at a point where we can force.
Because Alan is just about conscious, the law says Alistair cannot make him go to hospital.
We'd really like him to get some attention in hospital. It is what it is, I'm afraid. Just can't make them go anywhere. If you can't wake him up at some point in the next hour or two, you need to call 999. Okay? Yeah. Anything that's giving you serious concern, we need to know and come back. Yeah? Make sure you ring us if something changes. Okay.
And so it was bleeding quite a lot. Can you move your foot? Yeah, that's good.
On a Birmingham building site, construction worker Mark has lost a lot of blood after falling and ripping open his right calf on a scaffold pole.
And that's the only injury that you've got at the moment,
just that one, yeah.
Colleagues bandage the wound, but now critical care paramedic Steve needs to assess the injury and see if it requires immediate surgery.
I'm going to cut your jeans up a bit, fella.
Okay, bye.
So if you get the bandage ready.
A serious arterial wound can result in death in 5 minutes.
So who did this? Your colleagues?
Nice, yeah.
Yeah, they did really well then to stop.
Yeah, it's very
It's
good.
a little bit soaked. Okay, so what we'll do, I'll cut it, keep the pressure on it, and then lift, and then have a quick cursory look. You know.
The soaked-through temporary dressing is removed to reveal an 8-inch wide gaping wound.
Oh, so let's cover it up so I can see muscle and fatty tissue. You know, it needs some cleaning and hospital. Probably need to go to theatres for it just to get it washed out.
Yeah.
That piece of metal has gone through your skin and gone through the muscle sort of layers.
Yeah.
But you've got good circulation, you've got good movement. So it's just an isolated injury. So we're just going to find out the best hospital to take you.
Yeah.
Confident that Mark isn't at risk of bleeding out, Steve now wants to get him to hospital as quickly as possible.
Hi, Ben, it's Steve. Hi, mate. Yeah, it's not very good. So you got a 59-year-old male patient that he was working up on a little bit of a height, and then he's sort of fallen back. And as he's fallen back, his right calf has gone past a metal sort of sharp object and sort of torn his right calf open. But it's the whole length of his right calf. So GCS of 15, heart rate of 68, blood pressure of 167/73. It does look quite nasty. There's some skin loss, so I'll probably think it's probably best to go to the QE just because of this injury.
Mark's wound may require a skin graft, so he is sending him to the specialist doctors at Birmingham's Queen Elizabeth Hospital.
So you don't want any pain relief at all?
No.
You're happy?
With the situation under control, Steve decides to leave Mark in the care of the ambulance crew for the journey to hospital.
Happy?
Yeah, happy, thank you.
Look after yourself.
Thanks a lot, thanks
Yeah. No worries.
All good.
As Steve waits for his next emergency, he can reflect on how much worse things could have been for Mark.
What we need to be worried about is people suffering with catastrophic hemorrhage. So if it had nicked an artery and they hadn't have got pressure on that to stop that artery from bleeding, then things could be a lot worse. But although it does look quite bad, you know, hopefully it'll make a speedy recovery.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
So this is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road, and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
Oh no, mate. Oh no, we're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
He's got a traumatic brain injury.
a head-on collision leaves a man fighting for his life.
We have to presume he's bleeding in his brain.
Multiple stabbings in a nightclub.
Hey, all right, man, in fact, with the ambulance, mate, all right?
A child has a deadly allergic reaction.
Can you do this medical alert? This swelling is getting more pronounced. Okay.
And a motorbike accident leaves a man in agony.
We'll just keep it in mind that open pelvis.
So I've checked the critical care drugs. I'm happy with those.
Lovely.
You've got all your armoury there, Mark.
That's fine, I'm happy.
It's Saturday night in Oldbury, and Dr. Mark Nash and critical care paramedic Colin Apps are about to start a 12-hour shift.
You could argue that Saturday nights people are more likely to be out having a drink, enjoying themselves, and therefore later on in the evening we might get some fights. Road accidents increase when people have been out drinking, but yes, there are possibly certain patterns to what we might see on a Saturday, but we will go open-minded to everything like we always do and see what happens.
Ambulance service, is the patient breathing?
I'm a taxi driver. I seen a just accident on by the Moxie before the roundabout.
Okay, and how many vehicles are involved?
Just only one vehicle. Is there someone in there as well?
Is the person breathing?
1 second. Hello?
Hello, is the patient breathing and conscious?
No. There's one patient. He's grunting. His hands are cold.
Is he awake?
No.
Okay.
Non responsive.
Is somebody starting CPR?
Yeah.
Is he trapped within the car?
I think you'll need to take the roof off to get him out.
We're coming on blue lights and sirens as quick as we can, okay?
No, that's all right, thank you.
Police, fire brigade and the ambulance service are all en route to the scene. But with a man's life in danger, Mark and Colin are also needed.
Never good, never good. Road traffic accident, I think car versus wall. Good mixture of things coming through, giving us unconscious and giving us cardiac arrest.
It's unclear if the driver has suffered a cardiac arrest and crashed his car, or his injuries are so severe that he has lost consciousness. Either way, he needs urgent critical care.
Immediate police and fire to my location.
Sounds a bit panicked.
Whiskey 55, just confirm, police are en route.
As the other emergency services converge on scene, Mark and Colin must brace themselves for what they will find.
No, it's on scene. So there are cars in front of this thing, just be aware there's people there. Yeah.
Arriving at the crash site, they discover the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring.
Guys, do you want to give some space so we can work with it, yeah?
A large group of passers-by have gathered.
Line across the car, GCS3. Okay. So we've looked tonight. Cheers. Got a massive heading. Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cole, we're gonna do after drugs and yeah, go.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here, can't we? I think we've got enough space here, haven't we?
Yeah, we do it here and then...
As they prepare to perform this major life-saving intervention...
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? Mark, they nearly got him strapped on, so we might as well just lift him up onto the...
Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
Cole, you can just stay there and just rotate round, can't you?
Ambulance service, the patient breathing.
I've got two stabbings. Yeah, two stabbings. What's he stabbed in his back? One of my bridges is passing out.
Sir, listen to me. I don't know how to breathe.
Please help me, man. My bridges are dying, man. Please. Hey guys, so yeah, we've got that stabbing, it's a double stabbing in Wolverhampton. We're running out of channel 81. If you're to clear and start heading that way, that would be great.
Yeah, send it on us, mate. We're good to go. I'll change over channel now.
Police and ambulance have been dispatched to the nightclub where the attacks have taken place. Reducing the number of deaths from stabbings is one of the critical care team's main objectives. So paramedic Ian Locke and Dr. Ravi Chauhan are also en route.
The fight is still going on at this location, so offenders still on scene, fight going on in the background.
For Ian and Ravi, being called to a stabbing is far from unusual. In the West Midlands, there are around 60 stabbings a week.
Well, so the update from there was there's a large fight and reports of 2 people stabbed. The fight is apparently still ongoing. So.
With the attackers still believed to be on scene, Ian and Ravi wait until the police give them the all clear. West Midlands Ambulance Service deal with around 1,000 casualties from road traffic incidents every year.
I've lost count of the amount of fatal RTCs that I've been to in my ambulance service career.
Rescuing the injured in these fast-moving, dangerous environments relies on absolute teamwork from police, fire brigade, ambulance and the critical care team.
We've got 2 OMs running on this and a total of 3 DMAs and yourself over.
Working with other services, you know, that it's not just like one person, it's just like everybody doing like a little bit. And actually, when you sort of step back and you see it all sort of unfolding, it is really good. And like they're like some of the best in the country, so you can't really ask for a better bunch to work with.
Check the battery on this before we do anything else. Battery's full, that's good.
39-year-old Pete Edwards has been part of the critical care team for the past 2 years. Like all team members, his specialist training means Pete has the skills and equipment to treat critically ill patients, often making the difference between life and death.
This is something that you'd see in hospital every day, you know, this sort of equipment, as are these ventilators that we have in this blue bag. You know, it's stuff that's frequently used in hospital, and it's now coming into the pre-hospital setting as well. This can be used to take away human error sometimes, or to free up a pair of hands. You know, you don't have to focus while this is doing what it's set up to do. You can concentrate on something else. So, quite handy.
Ambulance service, is the patient breathing?
Yes, he is breathing. A motorcyclist has been thrown off his motorbike, literally hit the other lane. His bike at the central reservation is actually in the opposite side of the road, going the opposite way. He's not moved since he's in October.
No, and he's still in the other lane, he's still in the middle of the road.
He is, yeah, he is. He's in the middle of the road, lying on the floor in the oncoming traffic. He is breathing, but he's in a lot of pain. He can't feel his hip. Pain in his right shoulder, right knee, right hip, and left knee.
Has he taken his helmet off?
No, we haven't. He's still on. Yeah, is that good?
Yes, leave the helmet on.
A serious motorcycle versus car accident can be a code red emergency. An ambulance has been sent, but critical care backup is also needed.
Minimal protection on a motorcycle. I mean, the head's obviously protected with a helmet, but the rest of the body's exposed, and even the helmet, I mean, with a decent enough impact, it'll still cause a really significant head injury. Some of the things we always look out for with a motorcyclist is a fractured pelvis, because that can be quite rapidly life-threatening. How you doing, all right?
So we've got Ian here.
Ian. Hello, Ian. I'm Pete, one of the CCPs.
So
Okay.
at the moment we're complaining of right shoulder pain. That's his biggest pain area that he's got at the moment.
Yep.
Right hip and left knee.
On the busy A34, a car caused 53-year-old wire fitter Ian to hit the curb, throwing him off his bike across the grass verge, narrowly missing the oncoming traffic.
I know it's painful. I'm ever so sorry. We need to get you out of the cold. We're just going to lift you up, get you in the warm, we'll get you something for the pain, mate, all right? He's come quite a distance off his bike.
The ambulance crew members have immobilised Ian's neck and spine. If he has broken his back, moving him risks damaging his spinal cord and leaving him with permanent disabilities.
I'm just going to let control know what's going on from the scene. 7062. Number of patients is 1 motorcyclist. So far complaining of pain in his right hip and right shoulder. We're just going to get him on the vehicle. We'll do a proper assessment once on board and get you an admit shortly. Cheers. You all right, mate? Do you know him? Is it your dad? He's all right, OK? We've just got to assess. He's been knocked off his bike, but he's talking to us, he's conscious.
Ian's concerned son has arrived on scene. He was called by one of the witnesses to the accident.
Don't worry, we're going to look after him, all right? And we'll get him sorted. Here, mate. Where's the most...
The slightest movement has Ian screaming in agony. The signs are this could be a very serious injury.
At the moment, I'm concerned about his pelvis because he's complaining some pain in the hip on the right side. If anybody's in a position to start while they're stripping off, get some obs. Charlotte, OK. We'll just keep it in mind, open pelvis.
An open book fracture of the pelvis is one of the deadliest injuries because the pelvis contains major blood vessels which, if damaged, can lead to significant blood loss and cause the patient to go into shock and die.
Yeah.
Your vehicle, can you come to see to the location, please?
Lots of flags.
Critical care paramedic Ian Locke and Dr. Ravi Chauhan are en route to a multiple stabbing. A fight has broken out at a crowded nightclub, leaving 2 victims in its wake.
Right, back away, or we're not going nowhere, yeah?
The scene is too dangerous and volatile for our crew to continue filming, but Ravi's body cam keeps recording the unfolding drama.
Cheers, mate. All right, thanks, mate.
Despite the danger to themselves, Ravi and Ian know if they don't treat their patients quickly, they could die.
He's got 2 stab wounds to his lower back.
OK, yeah.
There's one with a single stab wound to the upper thorax at the back.
OK.
There.
Buddy, hey, right, my name's back with the ambulance, mate, all right? Just have a little seat for me, just so we can have a look, mate, all right?
A single knife wound can sever a major artery, causing death within 5 minutes.
I am blessed, man. I am blessed. Not blessed, man. Not blessed. I'm talking here. I'm blessed here. I can walk. I can walk. I'm blessed. I can go home. I'm blessed. Sir. I can go home. I'm blessed.
2, there and there. OK.
Just sit here for a second. Just sit here. All right. Just lean forward.
Putting a little dressing on your back, all right, mate?
I'm all right, mate.
Yeah, but...
No, you're not. You just...
Ian needs to check the first victim to determine whether his wounds are life-threatening.
All right, just relax for us, mate. OK.
But it's a tense and aggressive situation.
You don't stab me though, my fucking mum got shot, that's it.
Right, not now you won't, not now, buddy, not now. Just relax, all right?
Just look, just listen to us. Just sit down, all right? Let us just do what we need to do, all right?
The man has 2 stab wounds and needs hospital attention, but Ian's assessed his life isn't in immediate danger.
You need to go to hospital, mate. You need to go to hospital, all right. You do, mate, you do. Yeah, we're just going to go and look at him, mate.
They move on to find and assess the other stab victim.
You all right, mate?
Okay, fair enough.
Yeah, what's happened? So he's been...
He's got stabbed in there.
Okay, fine. Just take this off for a second, mate.
What way there was?
Huh?
Just 1 second, please.
Yeah, just take the whole thing off.
Yo, who's that?
First, the ambulance.
You can't be touching me like that.
Calm down, man. Just relax.
Boss, you can't be touching me like that.
Okay, all right. Calm down.
The wound is close to both heart and left lung. At the very least, there's likely to be internal bleeding.
Just sit back for a second.
I can't.
Yeah, I need to just have a look.
Buddy, let him do his job. He needs to
He's an ambulance, man.
He's checking that you've got no other injuries.
All right. Are you finding it difficult to breathe?
I can't breathe.
Okay. All right.
I'm sorry.
That's all right. Sorry, I need you to sit back for a second.
Whoa, wait there. No. Boss, it hurts.
Okay, it hurts on this side, yeah?
Hurts.
Okay, take a big breath in.
Like, I ain't from baby.
Okay.
The wound may only be an inch wide, but Ravi knows it could have caused significant damage.
Keep that on for a second. You all right walking out?
I don't know.
All right, I'll get you a chair. If you get a chair, mate. He's got left side. Okay. He's got worsening, like surgical emphysema, starting to swell around his back.
Okay. Ravi suspects the knife has punctured his patient's lung, a potentially fatal condition that could cause respiratory failure.
Listen, what I need you to do, I need you to get into this chair. Right, we need to get into the ambulance quickly, all right? All right, sit back.
2 stab wounds, here and here. 1 stab wound right arm. Issues, he's been GCS15 throughout. Last blood pressure was that. He's had a gram of TXA, he's got IV access there. He needs to go on the back, he needs to go to QE. I'll get some fluids and keep an eye on him.
Outside, Ian hands over 1 victim with multiple stab wounds to the ambulance crew.
Should we go with that one?
Both he and Ravi will travel in the other ambulance with the more seriously injured victim. They take him to the Queen Elizabeth Major Trauma Centre in Birmingham. He is one of 5 stabbing victims that are treated here every week.
I'm feeling a little bit precious this morning.
Starting his first shift back from holiday is critical care paramedic Ryan James.
So I'm hoping for a nice little relaxed shift, ease myself back into the working week. But you know, I would think with my luck, we're probably going to be pretty busy. Because it's always the case, isn't it? If you want a nice ease back into your working week, then it's never going to be. 7062.
Just checking you there, you checked and all of that business over.
Yep, I'm here, matey. Good to go. Look after me today. It's my first day back off my holiday. Received.
Hello, you speak to the ambulance service. Is the patient breathing?
Yeah, he just walked out and fell right over. He thinks he's broke his ankle. He slipped on the ground, it's wet.
And it's his ankle that he thinks is broken?
Yeah.
Has he got an obvious deformity?
Have you got an obvious deformity on it?
The bone pops out. It's deformed. Did he say it's going the other way?
He said it's deformed.
We will be there to him very shortly. Yeah,
okay then.
According to the update I've just received, this gentleman has got a angulated, complicated fracture. Basically, his foot is facing a different way to where it should be facing. And we have got some alternative analgesia that the crews don't carry in the form of intravenous ketamine.
With complex fractures, there is a risk that the deformed broken bones are interfering with blood supply to his foot.
The crew's still not happening, so no updates for you, but I'll keep you running over.
6-2, Roger, all received.
Ryan may have to perform an emergency intervention to realign the foot, an agonising procedure that requires skilled use of high-strength sedatives.
What I shall do is we're just pulling up in about 30 seconds. We'll go and have a chat, see if we can assist.
It looks like he's not going to get the post-holiday easy ride he was hoping for.
Here we go.
The critical care team and Midlands Air Ambulance serves a population of over 6 million people.
There's a 13-year-old male, jumped query fallen from an upstairs window.
It was set up following a study on trauma survival rates that found providing hospital-level care and decision-making at the roadside could save more lives.
Bringing the hospital to the patient, that has a really high impact on patients, such that you can get them to hospital in a much stronger and more stable position than they would otherwise have been.
In Wednesbury, 8 miles northwest of Birmingham.
Right, guys, so current plan, you're doing a grand job. What we're going to do in a minute is we're going to go up onto the trolley there.
Dr. Mark Nash and critical care paramedic Colin Apps are trying to save the life of a 38-year-old driver who is unconscious with a serious head trauma and may be suffering from a potentially fatal bleed on the brain.
Colin's going to be on the right-hand side of all the airway kit. What we're trying to do is we'll just move the monitor down to be alongside. Is that okay? Does it make sense? Yeah? Cool. So I'm going to do ketamine, sucks, and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be literally going straight up there, and then we're going to put a tube down him and go from there.
The patient could die at any moment. So Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Cole, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just need a bit of syringe in the end. There's the KY.
Suxamethonium and rocuronium are two fast-acting muscle relaxants that will temporarily paralyse the man's muscles. A mechanical ventilator will then breathe for him.
Just pop them on his chest for now, we don't need them taped in. Are you ready to lift and come onto here? So just come round and spin round. Yeah, head there.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, two take. Left foot. You happy at the top end? Yeah. Cool.
Put a blanket over his chest if we can. Have we got access yet? We need 2 lots of IV access then.
Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes 1, verbal 1, and then it's just motor is varying. As if anything, he's doing abnormal flexion, isn't he? Right, monitor-wise, just want to look at the monitor. So let's run back on. So we've got ECG on. I'm glad to try and do blood pressure again because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment. Is he fighting on that arm, or is it just...
Yeah, trying to take the mask off, I think.
No, just think about the blood pressure, why it's going...
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. Okay. Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to. Yep, quarter to. Yeah, I think everything's very cold. It's a heart. Right, this is going to be a token 50. Okay, and Sux is going through now.
The dose of Sux will take a minute to take effect.
quite strong on that.
Let me know when you're ready, sir.
Yeah, that's the drug kicking in. Quite slow circulation, right, actually.
As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralysed, unable to even breathe for himself.
OK, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
It's epiglottis, grade 1. Yeah, already?
Yeah, he's got just a large epiglottis.
OK, bougies through, ready for the tube.
The effect of the paralysing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
OK, got the tube. Yep, tube. Bougie out. OK, right. Again, yeah, got good movement. OK, I'm coming off the cricoid. I'm going to give him some rock because I can feel him moving already. So you'll have the top tube hold on.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
The rock's in. OK, happy?
Yeah.
If we can start wrapping him up. So have your fluids at the top there, aren't you? Yeah. So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
Right, happy there, Cole?
Yeah.
Thank you.
Yeah, thank you.
Guys, anyone seen anything we've missed? So we're happy, airway secure, we're breathing nicely.
We are.
OK, Sats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
All right, we'll get him on the ventilator as soon as he's in the back of the ambulance then. You ready?
Well, how far is it to QE from here?
20 minutes.
Mark and Colin will travel with the patient to provide critical care throughout the journey.
So, male, unclear of the mechanism. There seems to be cars involved.
Mark updates controls so they can alert the hospital.
He has, looks like an open brain injury. As far as we can see, there's an injury to his back of his head, which definitely was a flap of skin, and so he's got a traumatic brain injury. So we have to presume he's bleeding in his brain. So he's now been RSI'd. ETA, I think we're going for 15 minutes. We'll say 15 minutes.
15 minutes out, Mark administers another dose of the muscle relaxant combined with a sedative.
At this moment in time, we don't want him to be straining against any of what we're doing. We just want to keep it nice and steady and flat. The numbers we've got on the screen are perfect for us at the moment, and so if we can keep him just the way he is until we get to hospital, then that's better for us, better for the patient. They can then reassess, once they've got the scan, they can make a decision what they're going to do after that.
Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
That patient there, the longer he went without his airway being protected and us controlling the oxygen and the carbon dioxide levels, the more damage that potentially could happen to his brain. And what we hope is that by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference. And that is our bread and butter, to go to these sick patients, work with the crews on infrequent events for them, but frequent for us.
12 miles away in Cosley,
hello,
critical care paramedic Ryan has just arrived at the home of a man who has badly broken his ankle. The bones are protruding through the skin.
What's happening? Hi, Adrian.
He slipped outside and he thinks his ankle displaced. He's not sure whether it's gone outwards or inwards.
Sure.
47-year-old Adrian lives with his parents. After he fell, he managed to drag himself back inside and his father called 999.
Not the Sunday morning you were hoping for, then?
No, not really.
No.
Tatty's ready.
I know, I've just noticed you've got your Sunday roast all prepared, ready to go.
Knew we were coming, didn't we?
A complex open fracture must be quickly realigned to prevent serious infections and re-establish blood flow to the foot. It's a procedure Ryan has done many times.
He's clicked it 3 times back into alignment.
Have you actually? What, before these ladies got here?
But today, his skills won't be needed.
Wow, mate, I can't believe you've put that back into alignment. You know. What made you do that, do you think? Was it just hurting too much, or...?
Yeah, well, I thought I was going to try to get up.
Yeah.
And I thought, I ain't going to get up without it the way it was. So
Yeah.
I just...
How far angulated was it? How far...?
It just stayed right. 3 times over.
Really? Blimey. Back old school treatment. I don't even know why you needed us to arrive, really.
Adrian's dexterity has served him well. Incredibly, he managed to manipulate the bones back into alignment himself. A delicate and agonizing procedure that usually requires high-strength painkillers and sedatives.
You're a brave chap. I'm surprised you haven't just called a taxi and hobbled on in there. There you go. Right, hold that on your mouth and nose. Make a tight seal. That's it. And then just breathe that through. I think we'll get you to a state of mind where you're not worried about what we're doing, and then we can pop your foot on that splint and get you splinted. Do you want to do leg or splint?
Happy his pain-tolerant patient doesn't need any advanced pain relief, Ryan continues to give Adrian gas and air to take the edge off any discomfort he may feel.
Happy? I'll go above and below. You slide it up. Okay, just going to lift your leg up now, OK? Nice deep breaths. Nice colour, nice circulation. Keep going, keep going. You've got the old... that's it, on that side. Right, what this is just going to do is just going to tighten up around your leg and go firm, OK?
To stop the bones coming out of alignment on the journey, the ankle is encased in a vacuum splint.
Ready, set, lift. That's it. Keep your arms in, mate. Happy? Ready, set, lever.
Once he's on the ambulance...
All right, ladies, take care. Nice to meet you. All the best, mate.
Ryan is happy to leave Adrian in the care of the crew while he gets ready for his next emergency.
He's clicked it 3 times back into normal alignment before the ambulance crew and myself got there. So pretty impressive, really. Strength and determination of Adrian to be able to have done that to himself, you know, is commendable. You don't see that very often.
Ambulance service, did the patient breathe in?
Yes, it's my 2-year daughter.
And what's the reason for the call today?
She cannot open eyes, full swelling on her face.
And it's her whole face that's swollen?
Whole face, especially eyes. Now she wants to sleep.
Okay, if you pick her up, does she go limp or floppy like a rag doll?
Oh, yes, everything.
Everything's floppy?
Yeah.
Okay. Has she had a very severe allergic reaction before?
Never, ever.
We have got that help coming as quickly as we can.
15 days later, patient has bilateral wheezes and evidence of facial swelling.
So have we got any history on this address, what they're allergic to, ever?
Can't get anything in the video, mate.
No worries.
An ambulance has been dispatched to the address, but a 22-month-old child suffering a severe allergic reaction is a code red emergency, so critical care paramedic Steve Mason has also been scrambled.
If they've got facial swelling, you need to be concerned about, you know, the airway being closed and then that compromising the patient, because obviously they haven't got an airway, they can't breathe, and there's some abnormal soundings on this patient's lungs. So a wheeze can indicate that, you know, the airways are quite tight and constricted. So, well, it can be life-threatening.
The child's worried mother has reported her breathing is laboured. Steve knows in these emergencies every second counts.
Ian, have you got any medical problems? No. And have you got any allergies? No. Can you lift your right leg up a little bit? Yeah? Nice, okay.
In Birmingham, Ian, a 53-year-old motorcyclist, has been thrown off his bike, and critical care paramedic Pete has not yet ruled out a fractured pelvis, which could be life-threatening.
Sorry, in your right leg? Is that any pain?
Yes.
Where?
In here.
Okay. I suspect it's more hip at the moment. He's moving all his limbs, he's lifting his legs, which is, because we were concerned about his pelvis, but he can lift his legs, which I think that's a positive sign in terms of hopefully it's more hip than it is a true pelvis injury. But where's that pain, Ian, in your hip?
Yeah, you see that there.
And again for me.
Yeah.
Ian, can you turn this foot, can you turn it to the side? He's able to rotate it. Yeah. And this one, and can you try and lift it again a bit?
That hurts.
Where about? Okay, relax. He's holding his leg up. Okay. So like anatomically, he looks in line, his lung bones are intact. So if anything, since the time we've been with him, his heart rate has actually gone down. Yeah. So I think if that was pelvis and he was bleeding, his heart rate would go up potentially. He'd look pale and sweaty. He's not. He can lift both legs, and I think the pain is more on the side. So I think that's more hip than it is a open pelvis.
Pete doesn't think this is a life-threatening open book pelvic fracture, but without the benefit of an X-ray, he can't rule out any other fractures.
That's it. I'll keep his. Pull him out. There's another one out. Yeah.
Which one, right?
Ian's right arm and shoulder are giving Pete cause for concern.
Bear with us, Ian. Is it the shoulder, Ian, that's the worst? Ian?
Yeah.
It's the shoulder, yeah?
You have to excuse my language, but I ain't gonna be quiet with it.
All right. Ian, bear with us. We're going to get you some pain relief as soon as we can get to one of your arms, mate. All right?
I mean, just in his position,
yeah,
it looks lower than the left
shoulder
at the minute.
He's got severe pain in his right shoulder, so I suspect he's got a fracture dislocation somewhere there.
No.
Details of how the crash happened will help Pete understand his chest and shoulder injuries.
Rough idea, Ian. Do you know how fast you were going when you collided with a car?
No.
And did you go through the air, or did you slide across the floor?
No, I hit the cone. As soon as I hit the cone, I lost it. Hit the cone, hit the curb, and then I just fell off the bike.
So you've just fallen off, you didn't go like flying through the air, you don't?
Yeah, hit the curb, or I just slid.
And it sent you up in the air, did it?
Yeah, you can see I don't know whether it went over the handlebars or I just couldn't save it.
Okay, no worries.
You can see the scrape marks, as I say, on the road.
Take a big deep breath in for me. And out.
Ian's breathing is normal, but he has a suspected dislocated shoulder and a hip injury.
Can I just confirm that with you? IV paracetamol 07 2021.
Yeah.
All right. Okay. And we found no other injuries, have we?
Pete contacts control, who will alert the hospital of Ian's arrival.
So yeah, what I'll probably do then, we'll send him to Sandwell, and I think I don't need to travel. Bye-bye. Okay, I'll leave you to it. All right, nice. Thanks a lot. All the best, Ian. Take care. See you now. He did have a lot of protective gear on, which is a good thing, but we still have to be really cautious about injuries and, have a high suspicion. We're a bit concerned about his pelvis, but what we class as a true life-threatening open pelvis fracture, I think that's unlikely in his case. If he's got a shoulder dislocation or a fracture, we're going to get him to the nearest hospital, which is a trauma unit, so they'll be able to deal with him.
Hi, you all right?
Yeah. In Smethwick, Steve has just arrived at the house of 22-month-old Anit,
Every day.
who has a wheezing chest and an increasingly puffy face.
It's got a lot worse in the 10 minutes.
What has she sort of been allergic to, do you know?
All indications of a serious allergic reaction that needs emergency treatment.
The only thing that she's had is Weetabix.
Weetabix, okay.
We don't know anything else to, obviously, what it could be, but she had Weetabix last week and was fine, wasn't she?
Every day she had
Every day, yeah.
Rivina she had every day, so both things normal never.
Has this happened before at all, or?
No, my other daughter had this reaction before because she had a reaction from nuts, but not she, never had.
Okay.
After her usual breakfast, Anit's face started swelling and she became worryingly subdued, so her mum rang 999.
So we're happy with her sats at the moment.
Yeah.
So I think what we'll do, because unsure what's going on, if we just head to the children's now, yeah.
Although Anit seems very calm, allergic reactions in children can quickly escalate from mild itch to life-endangering anaphylactic shock.
We'll just take her in.
I just said it is quite a bad reaction now.
Okay, jump on. There's nothing to worry about, Mum, okay? I'm just going to take him to the right hospital, just for be assessed, okay? Okay. Yeah, whenever you're ready, yeah.
Can you sit there, please, Mum? Is that okay?
If her condition worsens, the best place for Anit to be is in hospital. So Steve decides to get her there as quickly as possible with minimum fuss and intervention.
Oh, dear me. Can you do this medical alert, please?
He will make the 3-mile journey to the nearest children's unit with Anit, calling control to prep the hospital for her arrival.
A 22-month-old. She's developed a sort of swelling to her eyes and to her sort of face area. This swelling is getting more pronounced, so we're just going to alert back into Sandwell, please. And we'll be at Sandwell in how long? In about 5 minutes. And this is unlike her to be nice and calm like this. Yeah, so her eyes have developed since I've been here a little bit, yeah.
It's developed quite a bit.
Yeah. She just looks a bit uncomfortable with all the itching. If that swelling gets really bad, affects the tongue, closes off the airway, then you've got potential airway issue. You've got no oxygen going into that patient. If the airway completely occludes, then, you know, what we need to do is try and act on that quickly to sort of stop that. So you said your other child suffers with this?
Yeah.
What has she been diagnosed with anything at all, or?
She had allergy from her sometimes.
Nuts.
This kind of allergy I seen on her.
Okay, and does she carry an EpiPen around with her? And no.
She's normally fit and fine, so the thing that just once she had allergy from that.
Okay, no worries.
In the last 5 years, the number of children hospitalised with life-threatening allergic reactions rose by 72%.
I'm concerned that she's got some swelling going on, so she's got a reaction to something. So whatever's going on, you know, it is looking at. She's a bit uncomfortable because she's scratching. You like Canada?
Arriving in hospital, Anit is carried through to the waiting paediatric doctors.
Really, with that patient, I think the more we would have done to her, the more stressed she would have become. So, hands-off approach, let her watch something on the phone, and she was nice and calm all the way in. Then we just got her in, which was great.